Welcome. This is the House Committee on Judiciary. It is Monday, March 6, 2023, 2 p.m., and we're in the room 35 of the State House. It has been the case since we began this legislative session that I read something to the members of the public and to those who are listening on Capitol TV. There's been misunderstandings over the years about what holding a bill for further study means. And so for the remainder of the year, we're going to see if we can bring it to a head. And this would be a perfect example with some of the bills and the interest in these bills today. So before the committee starts hearing testimony on the bills on today's agenda, I'm going to ask for a motion to hold the bills for further study. I'd like to remind the committee that a vote in favor of holding all bills for further study is not substantive and does not signify any position on the merits of the bills. This motion is procedural only and simply allows the committee sufficient time to review both verbal and written testimony and to organize the hearing process. And also, in my case, to consult legal counsel who's here taking notes and advises me on issues sitting right next to you, Catherine. So it's helpful for me to meet him on a regular basis before we even consider what we're going to do with the bill and maybe amend it. So with that being said, do I have a motion to hold all bills for further study?
Second.
All those in favor signify by saying aye.
Aye.
Opposed, nay. The ayes have it. So, Majority Whip is still here, smiling as usual. Would you please come forward, Whip Kazarian? I'll introduce the bill 5006, an act related to state affairs and government, health care for children and pregnant women, equity.
Chairman, your microphone.
Oh, I'm sorry. This is a 5006. It's sponsored by Whip Kazarian, and it's an act related to equity in coverage for children and pregnant women. It provides for abortion coverage in the Medicaid program and repeal the abortion coverage exclusion for state employee insurance plans. And here we have Whip Kazarian, so I'll be happy to allow you to testify at your will, to explain it, and go from there. Thanks.
Wonderful. Thank you, Chairman. Thank you to the members of the committee. The bill before you today, H5006, is a simple bill that addresses a simple issue. This bill would fix the inequality in insurance coverage for abortion access in Rhode Island. Right now, an abortion is the only medical procedure that is not covered by all types of medical insurance plans offered in our state. This bill addresses a privacy issue. All patients should be able to make their own medical decisions with their doctors in privacy. No patient that is insured should have to rely on a GoFundMe or scrounging up dollars in order to get a medical procedure done. This bill also addresses an economic issue. By not passing this legislation, we are saying that people in Rhode Island have a right to reproductive care and privacy only if they can afford to pay for it. This bill fixes an entrenched classist belief that low-income women do not deserve the same access or dignity as high-income women. My last point, this bill is not about redebating the legality of abortion in our state. This chamber had that fight several years ago in 2019, and we decided that it should be legal. This bill is about ending a discriminatory practice that allows women in Rhode Island to have access to an abortion only if they are wealthy enough to pay for it, or only if they are lucky enough to be on a private insurance plan that covers it. Abortion is health care. Elected officials should not be able to deny anyone access to health services, including abortion, just because their income or their insurance provider does not cover it. I ask you all to support this legislation, and I welcome any questions from the committee. Thank you.
Any questions for the sponsor? Thank you very much. And I see that there are a person on either side of you.
I have a couple of our supporters here. I'll turn to Gretchen from Planned Parenthood first, and then we also have Nicole from the Coalition for Reproductive Freedom.
Gretchen?
Good afternoon, Chair Craven and honorable members of the House Judiciary Committee.
My name is Gretchen Raffa, Vice President of Public Policy Advocacy and Organizing with Planned Parenthood of Southern New England, testifying in strong support of House Bill 5006. We are so grateful for Whip Kazarian for her leadership in introducing this bill. Planned Parenthood provided sexual and reproductive health care to over 9,000 patients in the Providence Health Center last year. We believe all people should have access to quality, affordable health care as a basic human right, regardless of who you are, where you live, your income, or if you have health insurance. The Equality in Abortion Coverage Act will expand access to abortion in Rhode Island by adding abortion coverage to our state's Medicaid program, eliminating the ban on coverage for state employees. This would impact nearly 80,000 people covered by Medicaid and 6,500 state employees who are of reproductive age. This bill will ensure people can make the healthcare decisions that are best for them and their bodies without political interference. The facts are abortion is health care, it's normal, it's part of reproductive health care, and it's one of the safest medical procedures that approximately 1 in 4 women will have in the United States. Yet despite the facts of this basic health care, the rights affirmed by Roe v. Wade nearly 50 years ago were stolen from us last June by the United States Supreme Court. Thankfully, abortion is still legal in Rhode Island, yet we know that legality has never guaranteed access for all people. Even in our own state, hurdles like distance, money, being able to take time off from work, lack of health care coverage, or restrictions have stood in the way of people's health despite having the legal right. That's why we are with 2/3 of Rhode Island voters who support the Equality in Abortion Coverage Act. Access to care has never been more vital. 1 in 3 women of reproductive age and more trans and non-binary people no longer have access to abortion in the United States because 18 states have either banned or severely restricted this health care. The communities most harmed by these bans, including Medicaid bans, are already the communities that are already facing significant barriers to healthcare and financial opportunity because of this country's legacy of systemic racism and discrimination. Abortion is an economic issue for pregnant people and their families. When policymakers deny insurance coverage for abortion, pregnant people are either forced to carry the pregnancy against their will or pay for care out of their own pockets. Planned Parenthood strongly supports 5006. And the EACA is overwhelmingly supported by voters. In fact, 72% of voters believe that patients enrolled in Medicaid should have the same coverage for abortion as people with private insurance. Every day, people across this state and the country make deeply personal decisions about their pregnancies, medical decisions that should be private between a person and their medical provider. Those decisions deserve respect, regardless of the outcome of their pregnancy decision, and it should be free from shame and stigma and without political interference. By passing 5006, you can further protect abortion access in our state. We're also here in strong opposition of the anti-abortion bills, House 5047, House 5228, and House 5573. The true aim of these bills is not based in science or in healthcare. Instead, they're meant to shame and stigmatize doctors who provide abortions and patients who need access to essential, time-sensitive, safe, legal abortion care. And they would undermine the reproductive rights and autonomy of pregnant people in our state. So we urge the opposition of those 3 bills. In conclusion, I would like to thank the committee for hearing 5006, and we strongly urge the passage of the Equality and Abortion Coverage Act. Thank you, Chair Craven.
Thank you very much. Any questions for the witness? Oh, Jose.
Hi. Good afternoon, and all right, cool. Good afternoon, and thank you so much for your work. Very, very pleased to see you all before the committee and very supportive of this legislation. I'm just wondering if there's any information or research available, especially since 2019 and passing the RPA, in terms of folks who've been denied coverage or amount of cases that have not been able to get these sort of procedures as a result of these exceptions. In other words, how would this bill change? How many people would this affect, more or less?
Yeah, that's a great question. And there has been studies done that show that more people are being denied access to care and actually have a negative impact on their economic security. We can share more information from a recent study called the Turnaway Study. And I'm happy to follow up with the committee to let you know how many people have come to Planned Parenthood, especially since the overturning of Roe v. Wade. Our patients face, intersecting issues when they come to see us. They are not just coming here to access health care. They also are struggling a lot of times And we, thankfully, have an independent abortion fund in the state of Rhode Island, WEF, that helps fund people's health care. Unfortunately, the reality is for some of our patients, they actually have to get support privately to be able to get the health care, the essential basic health care that they need, because they can't get it through their Medicaid coverage, and they can't afford it themselves. So more people are relying on independent abortion funds like WEF to actually be able to access the health care that they need. But I'm happy to provide more numbers to the committee, too.
Any other questions? Okay. Floor is yours.
I'm Nicole Jelinek, the chair of the Rhode Island Coalition for Reproductive Freedom. Thank you, Chair Craven, and members of the House Judiciary Committee, and of course to Whip Kazarian, who has led this strong effort this year on the Equality and Abortion Coverage Act. I'm here to testify in support of House Bill 5006. Our coalition, we thank you also for your support for the Reproductive Privacy Act in 2019, and we see the consequences of other states not doing the same all across the United States post-Dobbs, as abortion has become illegal in many places. We're here today to talk about the gaps left after the RPA, the nearly 1/3 of Rhode Islanders whose health insurance doesn't cover abortion. I want to give you two quick examples. Consider Jane, a 31-year-old single mother of 3 children. She works full-time at a donut shop, and she starts her days at 4:30 a.m. 5 days a week. She relies on her extended family to get her eldest 2 children off to school each day, and then to provide daycare for the youngest child who's not yet school age. In the evenings, she takes 1 class at a time at community college to get her degree. She becomes pregnant unintentionally. Her insurance is Medicaid and won't cover abortion. She must borrow money from family and friends or tap into funds from the Women's Health and Education Fund in order to access essential health care. Now consider Sue. She's a 31-year-old married mother of 3 children, also the same ages. Her husband gets insurance for their family from his employer. She works part-time as a bookkeeper from home and is able to do her work around the hours that her children are at home. She also becomes pregnant unintentionally. She's able, in consultation with her husband and her doctor, to use her private insurance to cover her abortion. She need not tell anyone or wonder how to afford it or ask for loans to get money. This is what this is about: private insurance versus public insurance. It's about inequality and lack of access. 72 Rhode Islanders polled last year believe that people should have the same benefits regardless of whether they have public or private insurance, full stop. The Coalition for Reproductive Freedom began in the 1980s as the 2-to-1 Coalition after a proposed state constitutional amendment to ban abortion on the ballot in 1986 was voted down by 2-to-1. The coalition provided a means to harness the power of many voices to demand change and seek true reproductive freedom. Today, coming up on 40 years after that vote and the formation of this organization, we continue to need to exist as our work isn't done. We continue to work to actually realize the legal rights and make them accessible for all. I strongly encourage you to support and vote on H5006. Thank you.
Any questions for the witness? Thank you very much. Now, the next group of witnesses I'd like to call up are, I see the Secretary of State. What the heck's that kid's name again? I forget. I think I sat near him. And then I have 2, and Anna Whalen, and then I've got 2 witnesses for you, Steve Alves. Both of them are here. So if, you can come forward. Both of you can come forward. I'll get all the doctors out of here. They got to go see people like me. Secretary Amori, how are you?
I'm well, Chairman. I defer to the doctors if that's okay.
I would if I were you, yeah. Yeah.
All right, so hi, thank you to Chairman.
Can you hear
Everybody
me?
push the button up. Yeah, thanks.
Can
Can you hear me?
Yes.
Okay. Thank you, Chairman Craven and the House Judiciary Committee. My name is Dr. Anna Whalen. I am a board-certified obstetrician gynecologist, a fellow with the American College of OBGYNs, as well as a senior fellow in maternal fetal medicine, meaning I not only specialize in women's care, but I specialize specifically in the care of pregnant people and their fetuses. Not only that, I am a survivor of severe preeclampsia and of a NICU baby who spent 2 months away from my care. And I'm also an abortion provider. And I stand here in favor of House Bill 5006. A daily reality of my job includes counseling people on bad news, an unplanned pregnancy, a lethal fetal anomaly, and a life-threatening maternal medical condition. I always hold the ethical principles of autonomy and justice close to my heart when I counsel my patients. I tell them about the risks, the benefits, and the alternatives of each option I provide for care. What prevents me from providing the care that I try so hard to provide is when there is not justice in the law, and that the law makes my patients have to choose between their health care and feeding their loved ones, and paying their rent, or in having to ask for charity donations. People have abortions for many reasons, and all are valid. Laws that prohibit insurance coverage of abortion disproportionately affect those who are already at risk for suboptimal health outcomes, those who have been systematically devalued in our state and country's history. These are the patients for which the racism embedded in our healthcare system puts them at risk of severe maternal morbidity, including maternal death. Those without access to abortion care are at higher risk for pregnancy complications. This is something that we've seen in our state, but also throughout the country, particularly since the Dobbs decision. In our capitalist society, one of the only ways to move toward equitable health care, particularly equitable maternal care, is to remove financial barriers to full reproductive health care. If we want to truly improve the health care in the state of Rhode Island, we need to remove these barriers and approve the Equality in Abortion Coverage Act. Thank you.
Thank you very much. Any questions for the witness? Thank you, Doctor. I believe it's Sharon. You're the CEO of Women and Infants Hospital.
Hi, good afternoon. Thank you. My name is Shannon Sullivan. I am the President and Chief Operating Officer of Women and Infants Hospital, and I am also here to support Bill 5066. I want to thank the Commissioner and Whip Kazarian for giving me the time today. I will be very brief, as the physicians are much more knowledgeable than I am on a lot of the clinical pieces that we wanted to discuss. But I wanted to come today because I'm here as a leader, as one of the largest women's healthcare institutions in the country. I am also a perinatal social worker for the past 22 years, a mother, and a taxpayer. Every day, the clinical teams at Women and Infants manage the fallout of our patients who have not had access to services to terminate their pregnancy. It taxes our hospital, it taxes our child care institutions, it taxes our educational institutions, as just a few examples of supporting institutions to this bill. Restricting termination access for women to receive health care based on socioeconomic background is a health equity issue, an issue for our schools, and a financial issue for taxpayers. At Women and Infants, we want to add our voice that we strongly believe in the highest quality access to essential and necessary health care, no matter who you are or what your background is, and our support of our partners at Planned Parenthood and other clinicians and organizations who lock arms with us in our mission of a healthier Rhode Island. Thank you.
Thank you very much for your testimony. Any questions? Doctor.
Members of the committee, thank you. Good afternoon. My name is Dr. Ben Brown. I'm an obstetrician gynecologist, a health policy researcher, and the Mimi Peachy Assistant Professor of Obstetrics and Gynecology at Brown University. I'm speaking today on behalf of myself as a clinician and on behalf of Women and Infants and Care New England. And I wish to express strong support for the Equality in Abortion Coverage Act. As you've heard, under current regulations, Medicaid recipients and those with other state health insurance plans in Rhode Island are barred from using their insurance to pay for abortion care. This effectively creates a two-tiered system where wealthy people are able to afford comprehensive reproductive and sexual health care because they can pay out of pocket, while on the other hand, those with lower incomes may have their health decisions dictated to them by their insurance plans. Moreover, this funding barrier disproportionately affects Rhode Islanders of color, compounding other inequities due to racism. As a physician, my job is to counsel my patients non-judgmentally and to facilitate the care that they deem right for themselves. Medicaid funding for abortion is essential for healthcare professionals to provide this kind of patient-centered care. I know this firsthand. I was practicing in Illinois when that state's Medicaid funding bill went into effect. I remember counseling a patient I'll call Sierra. She worked a minimum wage job and had 2 other children at home. Sierra needed an abortion, which historically was not covered under her Medicaid plan. Today, Sierra was making calculations about whether she could pay for her medical care while also putting food on the table for her kids, paying for school supplies, and getting to and from her job. I told Sierra that thanks to the new law, she would not have to pay out of pocket for her care. After a moment of silent surprise, Sierra tearfully shared her gratitude and her relief, knowing that she would not have to choose between providing for her family and seeking health care for herself. And Sierra is not alone in having to overcome difficult financial circumstances in order to access abortion care. A 2013 study showed that 1 in 4 abortion patients lost wages due to the time needed to seek care. And in the same study, many patients also reported encountering additional expenses such as childcare and transportation costs. And being denied an abortion is associated with financial harms as well. A 2020 paper found that such denials resulted in an increase in past due debts, bankruptcies, and evictions. Equality in abortion coverage will make a profound difference for Rhode Islanders in situations like Sierra's, and it will be a critical step toward greater equity in our healthcare system. People in our state will no longer have to choose between providing basic necessities for their families and accessing the health care they need. And so I urge you to vote in favor of the Equality in Abortion Coverage Act. Thank you.
Thank you, Doctor. Secretary of State Greg Amore.
Thank you,
Welcome.
Chairman.
Good to see you.
Thank you. Appreciate it. Chairman Craven, members of the Judiciary Committee, and to Representative Kazarian, the sponsor of 5006. I am here not in my capacity as Secretary of State, but as a citizen of the state of Rhode Island, a resident of East Providence, a father of 2 daughters. And I'd like to talk to you about just process. The Reproductive Rights Act acknowledges that abortion is health care. The EACA acknowledges access to that health care. In my view, it is as simple as that. When you have classifications of people that cannot access health care, health insurance, that's an unfair situation. There are a myriad of issues in which American taxpayers pay taxes toward institutions that they do not agree with. The military and public education would be two that I agree with and happily contribute my tax dollars to because I support those things. But we can go through a list of things that American citizens do not support, but their taxpayer dollars provide for. This would be one of those. So I would encourage my former colleagues to consider 5006 and pass that this year to complete what is an incomplete statute at this time. Thank you very much, and I'd be happy to take any questions.
You sound like a history teacher. That was a very good presentation.
I used to be one.
I heard that.
Yeah.
Any questions for the Secretary of State in his private capacity as a citizen of the great city of East Providence? Seeing none, thank you very much, all of you, for your testimony. There are some other witnesses that are going to testify against, and then there are 2 other bills I want to introduce. I'd like to now put, there are 2 opposing bills to Whip Kazarian's bills, sponsored both by Representative Perez. And I'd like to put both of them in play, and then the witnesses that will be called forward as we proceed will be able to testify on any one of the 3 bills. So I don't see Representative Perez here. Is he not here? Okay. So the first is 5047. It's an act related to health and safety. Born Alive Infant Protection Act. It provides duties, obligations of medical personnel to born alive infants resulting from an abortion punishable as a felony, along with a civil action for compensatory punitive damages and an automatic 1-year license suspension. And the next is 5228. It's also sponsored by Representative Perez. It's an act related to criminal offenses, children, criminalizes the knowing and intentional failure of a physician, nurse, or other licensed medical personnel to provide reasonable medical care and treatment to an infant born alive as a felony. With both of those bills now in play, I'd like to call the General Treasurer's representative forward, Michelle Silva. And if you want to come forward, Rob. Welcome.
Good afternoon. Good afternoon, Chairman Craven and members of the Judiciary Committee. My name is Michelle Moreno Silva, and I appear before you today as a representative of Treasurer James Diosa. Treasurer Diosa asked that I offer testimony on his behalf as his communications director, as a state employee, and most importantly, as a woman of color in support of HB 5006. As with most other Rhode Island employees, I am enrolled in the state's healthcare plan. Though it offers many benefits, there is one notable absence. By law, it excludes coverage for abortions. The law likewise excludes state Medicare funding for abortions, but this restraint disproportionately impacts those most in need of financial assistance, the poorest in our state, who are most often families of color, living in neighborhoods like those where the Treasurer and I grew up in Central Falls. Across the nation, we've witnessed the consequences by an extreme Supreme Court after ripping away pregnant people's rights to make their own reproductive health care decisions. Here in Rhode Island, we are incredibly fortunate that our elected officials, including many of those on this committee and in this room, had the foresight and social cognizance to codify the protections embodied by Roe v. Wade into law. But the road first paved in 2019 remains incomplete. And today, Rhode Island remains only one of 2 states in New England that does not permit state Medicaid funds for an abortion. There are a number of devastating economic impacts when a pregnant person is unable to obtain an abortion due to financial constraints. And no person should have to decide over keeping a roof over their heads or putting food on the table due to significant out-of-pocket costs for abortion care. Such exclusions contradict the very nature of healthcare and constructively deny the right to bodily autonomy for many state workers and those of limited income. Absent the financial ability to afford an abortion, the right is little more than an illusion, a false promise. As a country founded on the noble idea of liberty, we must always strive to expand personal freedoms, not restrict them. The responsibility lies in your hands. With your vote in support of this legislation, you will be sending a message that will resonate across our country that reproductive freedom will again be the law of the land. Thank you.
Any questions for the witness? Seeing none, thank you very much for your testimony. All right, now all the bills are in play. We have a few other witnesses that are going to testify in favor of the bill. But I'd ask now that that witnesses try to restrict their testimony, hopefully without repetition, to a couple of minutes so that we'll have an opportunity to reach everybody in a reasonable period of time. So the next witness is, let's see, the Reverend Elizabeth Chandler Feltz from the Benefit Congregational United Church of Christ. Claire Chung, the Women's Health and Education Fund, and Susan Killenberg, the Women's Fund volunteer physician. Are any of them here? They could be in the overflow room? Okay. Welcome.
Thank you. My name is Elizabeth Chandler Feltz. I live in Pawtucket, and I am the senior minister of the Beneficent Congregational Church, United Church of Christ in downtown Providence. I am testifying in support of House Bill 5006. Here is why. In 1936, my maternal grandmother, Jessie, sent my mother off to summer camp. She then drove herself to an appointment where she had an illegal abortion. During the procedure, something went wrong, and Jessie died of toxic septicemia, blood poisoning, shortly afterward. This is not conjecture. It is spelled out clearly on her death certificate. Reproductive justice is personal for me. An unsafe abortion shattered the life of my young mother and robbed me of a grandmother I would never meet. Whenever abortion care is inaccessible, either because it has been criminalized or because it is financially prohibitive, it doesn't mean people will not seek abortions. They'll just seek expensive and often unsafe abortions. Some will die, just as Jessie died. Reproductive justice is also spiritual for me. As an ordained minister serving churches for more than 38 years, I take my scripture seriously. There is not a single verse in the Hebrew and Christian scriptures that prohibits abortion care, but there are thousands of verses that demand justice for people who can't meet their basic needs for safety and well-being. Reproductive care is first and foremost about safety and well-being. May Jessie live on in your resolve to uphold the safety and well-being of all Rhode Islanders. I stand with you in that resolve. Thank you.
Any questions? Seeing none. Next.
Is the mic on?
I think so.
All right. Thank you for the opportunity to speak in favor of the Equality in Abortion Coverage Act. My name is Dr. Susan Killenberg. I'm a psychiatrist and a board member for the Women's Fund of Rhode Island. Many here today will argue that abortion is essential health care. I certainly agree. As a psychiatrist, I want to add that abortion is also an essential mental health service. A person's ability to decide when and if to have a child is critical to that person's psychological well-being, and forcing somebody to carry an unwanted pregnancy to term can have profound mental health consequences. The hormonal changes in pregnancy can cause people to live with mood and anxiety disorders to have severe changes in mood, sleep, energy, and concentration. Their symptoms affect day-to-day functioning, work, and relationships, leaving some to decide they feel unable to carry a pregnancy to term. People with PTSD, when faced with a pregnancy, may experience an increase in traumatic memories from childhood, or their pregnancy may tie them to a violent partner in the present. People with chronic eating disorders struggle every day to nourish their bodies. Meeting the nutritional needs of a pregnancy can simply feel impossible. People with substance use disorders have very high rates of unintended pregnancies. For some, pregnancy leads to sobriety, but for others, pregnancy is overwhelming, leading to relapse and exposing the fetus to drugs and alcohol. On behalf of those living with mental health challenges, I urge you to remove insurance barriers to abortion care. Insurance bans on abortion prevent people from receiving a service that's critical to their psychological well-being. These bans have the potential to exacerbate a mental health crisis that's already affecting young people in our state and around this country. Finally, as many have stated, insurance bans on abortion predominantly affect low-income people and people of color. Therefore, they may also contribute to racial disparities in mental health. Please vote in favor of House Bill 5002 and remove these discriminatory bans to abortion care. Thank you.
Thank you. Claire?
Is that on?
Yes, it is.
Okay.
Yeah,
Thank you so much for hearing testimony today. My name is Claire Chung. I'm here on behalf of WEF, the Women's Health and Education Fund. The vision of Women's Health and Education Fund, or WEF, is that abortion and contraceptive care be accessible to all Rhode Island residents, regardless of their economic status or insurance coverage. We are Rhode Island's only abortion fund. This leaves 41% of Rhode Islanders without abortion coverage, either because they are state employees or because they're enrolled in Medicaid. We exist to cover that 41%. Last year, we disbursed nearly $74,000 to help fund abortion care in Rhode Island, serving about 500 individuals by providing monthly block grants directly to clinics in Rhode Island. Our clinic partners report that lack of coverage because abortion is excluded from publicly funded insurance is a major reason that patients need to draw from our grants. Financial instability is also a major reason for patients delaying abortion care, resulting in a more complicated and often more expensive procedure further down the road. This is important. And also we realize and we know that we are not meeting the needs in our state currently. And unlike other funds in the Northeast region and many of our cohorts, we are currently unable to contribute to solidarity funding for patients in other states who urgently need abortion care and can't afford it. I'll try not to be too redundant, but passing the Equality in Abortion Coverage Act affirms that Rhode Island residents get the bodily autonomy that they need, and that especially essential, and this is especially essential in a national climate that condones forced pregnancy. As Gretchen from Planned Parenthood said, over two-thirds of Rhode Islanders are in support of the EACA, and I am one of those Rhode Islanders. Thank you.
Thank you very much. Any questions from the committee? Thank you. And the next group of witnesses, I don't see Barth Bracey here, but if he's he's in the building? Okay. In the meantime, is Lisa Cooley here from the diocesan? And the Honorable, I don't even want to say former representative, Jimmy McLaughlin. Jimmy, would you come forward? Oh, this is an early St. Patrick's Day with McKenna, McLaughlin, and Cooley. Jeez. Go first, please. Thanks.
Thank you, members of the Judiciary Committee, for the opportunity to testify in favor of House Bill 5047 and oppose House Bill 5006. 5006, which seeks to provide abortion coverage in the Medicaid program, which means using taxpayer-funded money to pay for elective abortions. Medicaid already pays for emergency situations in these situations. Medicaid should not be used for elective abortions since they are not medically necessary and go against most Rhode Islanders' conscious rights. The Catholic Church firmly believes in the dignity of human life from the natural conception to natural death. When our answer to women and families who live in poverty is that there is no hope, which is what killing an innocent child tells them, we are not giving them the respect and dignity they deserve. This legislation treats economically disadvantaged pregnant mothers as an economic burden. Instead, we should be treating them with care and compassion by providing the necessities to sustain life: housing, nutrition, clothing, education, unemployment, prenatal care, and child care. Supporting life-affirming programs brings dignity, joy, hope, and love of neighbor. Supporting death brings despair, pain, and sorrow. I should know, I deal with a lot of these women with my Rachel's Vineyard ministry. A lot of them are forever wounded by what they have done and cannot reconcile the fact that they killed their own child until they find the necessary healing through our ministry. Last year in the Rhode Island State Budget Office, analysis said that public funding of the destruction of the unborn children through abortion, my goodness, produces a savings in the state budget. Is that what this comes down to? Money? The root of all evil? Do we have any sense of decency and morality left in this state? Advocating the destruction of human life to save funds? House Bill 5047, the Born Alive bill, is a common sense bill, I think. Rhode Island is in the minority of states that don't protect babies born alive in these cases. This is a moral test for this state. Let's see if the state can protect both the expectant mother and her unborn child and enable them to live and prosper. So I ask you to do the right thing for the common good of our state. The fact is that under this General Assembly, The preborn human child in Rhode Island has less legal protection than domestic pets. Thank you.
Any questions for the witness? Okay. James McLaughlin, how are you?
Mr. Chairman, members of the committee, I want to, well, first of all, wish us all a Happy New Year, and I want to thank you so much for your consideration. I'm here today in reference to the unborn, and basically House Bill 5006, 5007. I'm adamantly opposed to this bill. Okay, number one, taxpayer-funded abortions. No. My chain of thought. I'd like to give you something to really think about, and this goes beyond this bill and what is being said here today. We're talking about the immediate passage, if this bill passes, but we're talking about ramifications here, ramifications for future generations. Okay, we're talking about children that haven't even been born yet, okay, subject to this bill, if it passes, okay. The death sentence for children, okay. The death sentence for years to come, all right. If we pass this bill and give access to taxpayer-funded abortion. So I ask for your consideration, and I ask that you not support this bill. With that said, it's great to see all of you. And I'll be back. All right.
Thanks, Jim. Any questions for Representative McLaughlin? Bill McKenna, haven't seen you in a long time. How are you? Good. I think it is. No, it's not?
Is it on now? Okay. Let me propose a thought experiment for you. Imagine the bill before you dealt with kittens instead of babies. Imagine that the bill called for public funding for the burning, crushing, beheading, dismemberment, poisoning, or brain suctioning of kittens. Would you vote for it? How do you think the public would react? Would the sponsors frame the issue as if they were the champions for justice for low-income kitten owners? Would they frame the issue in terms of kitten owner rights? Would the SPCA be told to keep its moral outrage to itself? Or would there be general outrage at the thought that anyone would propose such a thing? Where is the moral outrage over this proposal, which is basically authorizing the state to pay for hitmen to kill babies in their mother's womb? Make no mistake, if you vote for this bill, you are personally contributing to the violent deaths of babies. You will be involved just as a boyfriend putting an abortion on a credit card. Only your vote will authorize payment for many more violent deaths. If you don't mind being complicit in killing, kill this bill instead. Thank you very much.
Any questions for Mr. McKenna? Thank you.
Thank you. Thank you.
Okay, the next group of witnesses, let's see, is Attorney Faye Dion here from the ACLU, and Nicole Jelnick from the Rhode Island Coalition for Reproductive Freedom. Oh, she already did? Okay. And Dira Edwards from Sister Fire. That's two. Let's see, we need one more to come up. Is Linda Katz here? Okay, great. Go ahead, thanks, welcome.
Good afternoon, Mr. Chairman, members of the committee. My name is Faye Dion.
Yeah, Faye, could you speak? Actually, I just saw you push it away from you. Can you bring it closer?
Yeah, right like
now you
this.
got to press the button again.
Okay.
There you go.
Challenge.
There you are.
Good afternoon, Mr. Chairman and members of the committee. My name is Faye Dion. I'm a member of the board of the Rhode Island ACLU, and I'm here on behalf of our Rhode Island ACLU to affirm our strong support for passage of House Bill 5006, Equality in Abortion Coverage Act, and our strong opposition to House Bills 4047 and 5228 relating to abortion, and House Bill 5573 relating to the wrongful death of a child in utero. With respect to the EACA, it is clear that notwithstanding Rhode Island's 2019 passage of the Reproductive Privacy Act, RPA, which codified the protections of Roe v. Wade and preserved the right to reproductive health care, there remains in our state, unfortunately, constituencies that are unable to exercise that right. You're likely to hear much more testimony from others today in support of the EACA. Rhode Island ACLU has also submitted written testimony on it, so I will not belabor these points other than to reaffirm our strong support of it. You're also likely to hear much more testimony from others today in support of the EACA. Today about House 4047 and H5228, two very poorly drafted bills desperately in search of a problem to solve. RACLU has also submitted written testimony on these bills and stands firmly against their passage as well. Today, however, I would like to draw closer attention to HH 573, which amends Rhode Island's civil wrongful death statute. The official explanation accompanying H 5573 is that it simply expands the statute of limitations in the existing statute of 6 years. On closer reading, however, the bill actually embeds a whole new cause of action based on the wrongful death of a child in utero or within 6 months of birth. It reads, with respect to any wrongful act, neglect, or default resulting in the death of a child in utero or within 6 months after the birth of the child, the action shall be commenced within 6 years after the death of the child. This is very problematic under current Rhode Island law, which distinguishes between the wrongful death of a viable versus a non-viable fetus, the former establishing the basis for civil damages recovery where the latter does not. Our written testimony provides the case law that supports that distinction. By drafting the bill as applicable to a child in utero, the sponsors are, intentionally or not, creating a minefield of issues for the RPA. On its face, it directly contravenes the RPA by creating a basis for recovery by a next of kin, one of the classes of potential plaintiffs designated in the current statute, to a non-viable fetus. It is not far-fetched to imagine a scenario where the spouse or partner of someone undergoing an abortion in the early stages of a pregnancy objects to that procedure and seeks recovery as next of kin to the unviable fetus. Equally concerning is the issue that rises where post-viability abortions are performed to preserve the life or health of the mother. This reproductive right, which was the law of the land up until the Dobbs decision and which was preserved and protected by the RPA, is directly undermined by the child in utero language of H 5573, since there is no acknowledgement in it of the exception for the life of, or health of the mother. The public overwhelmingly supports abortion access, with nearly 8 in 10 Americans opposed to the overturning of Roe v. Wade. Undermining access to safe legal abortion is wildly out of touch with the majority of voters in this country. This bill is a huge step backward, but could be rehabilitated by removal of the reference to child in utero, or even better, by expressly citing the RPA as not affected by the bill. And unless until our issues are addressed, Rhode Island ACLU strongly opposes this bill. Thank you. You have questions?
Thank you very much. And before I solicit any questions from the members of the committee, let me just put that last bill in play that you just referred to, and I'll simply refer to it as 5573, sponsored by Representative Perez, and it amends the wrongful death action, or statute rather, to involve certain wrongful death actions involving a child to 6 years old. So, with all of those in play, any questions of the witness? If not, Ms. Edwards?
Thank you, everyone. Thank you for the opportunity. My name is Deetra Edwards. I am the founder and executive director of Sister Fire. I am providing testimony in support of H5006. And I am speaking on behalf of Sister Fire. We are a network of women of color and non-binary people of color. We have a membership of over 200. And for the last 3 years, we have been engaged in a campaign for Black maternal health in Rhode Island. We do this work with the goal of reproductive justice, which is to define a human right to a bodily autonomy, to have children or not have children, to raise our families in safe and sustainable communities. This bill has huge impacts on multiple layers of that right, our right as a human. We fight for the right and need culturally competent, humble, holistic health care from perinatal to postpartum, and the access to abortion is critical along that path. Women of color are overrepresented in low-wage jobs and more likely to use state medical aid programs. Among women age 15 to 49, 29% of Black women, 25% of Latina women are enrolled in Medicare since 2019, compared with 15% of white women. This means taking health coverage for abortion desperately impacts and pushes care out of the reach for women of color. I'm not going to keep repeating the things that people have already said. It is really challenging to be in a state that often those of us who are women of color don't have the opportunity to speak for ourselves. This hearing is held in the middle of the day. Most of my members are working because they're working low-wage jobs. I am here because I am blessed to be a representative of over 200 women who have made a collective decision to be here. There's lots of people who have talked about women of color in this room but may not know women of color. What I am saying to you, the impact of this on our lives coming out of this pandemic, because we talk about things in isolation, but we need to talk about the intersection of a state that does not pay a living wage to a place that so many of us still are struggling to get back from the pandemic. We are asking you that these are intersectional issues that impact our lives on a daily basis. Not to take it lightly, but to stand in consciousness of actually seeing us as human beings. We thank you and we appreciate you.
Thank you for pointing that out. It's important that we know exactly not only how you feel, but how the community you represent feels. Thank you. Yes.
Good afternoon, members of the committee. My name is Linda Katz. I recently retired as the policy director at the Economic Progress Institute. I am speaking today on behalf of the Protect Our Healthcare Coalition, of which I am an individual member. The Protect Our Healthcare Coalition is a group of leading Rhode Island nonprofits and consumer groups with a goal to protect and promote comprehensive, quality, affordable health care for all. The coalition members that are listed on the written testimony that was provided to you support House Bill 5006 to end discrimination in access to coverage for abortion care. I'm not going to repeat all the good points that have been made by my colleagues and especially by my friend Deetra. I just wanted to point out, somebody has referenced that Rhode Island is one of only 2 states in New England that does not provide Medicaid covered abortions or state employee abortions, and there are actually 16 states around the country that do use their own dollars to ensure that there's equitable access to abortion coverage. So we urge the committee to support this important bill. Thank you for your time.
Thank you very much. Is Jackie Anderson here? And Marcella Betcure? Oh, is that Bettencourt? Oh, Latino Policy Institute? And then Jocelyn Foy, the Executive Director of the Women's Project? Okay.
Oh, here's Jocelyn.
Okay. Jackie, you can go ahead.
Okay.
Thanks.
I didn't know.
Yeah.
There we go. So first of all, my name is Jackie Anderson. I'm a lifelong resident of Rhode Island. I'm also a registered nurse who has worked in reproductive health care for over a decade, both in abortion care and in OBGYN. I'm here today in support of HB 5006. It saddens me that this is the second time in a year that I've had to testify in support of this bill that would significantly lessen the burden of our most underprivileged and at-risk citizens. Representative Batista, I know you asked questions about the Turnaway study, and I have those statistics for you after if you'd like them. I want to just kind of applaud Representative Kazarian, because this is not a new debate over the RPA. That is law here. This is whether or not we are allowing these funds to reach our most marginalized citizens, our citizens that are most in need. Most of the patients that I've had the honor of caring for during their abortions were already parents. The undue financial burden placed on already struggling parents further perpetuates their financial struggles. These are families that are just getting by and trying to be the best parents to their children that they can be. Rhode Island can be a leader in this movement, and it can show the country that we are leading the way in reproductive safety for our citizens. I'd also like to quickly add my dissent for HB 5047 and 5228 with special consideration to HB 5228. I can guarantee none of the sponsors of this bill has ever resuscitated a preterm infant. I personally have. It is violent, it has poor outcomes, especially when the infant is at the cusp of viability. These are your 23, 24 weekers, and in a 2017, a study described survival and neurological outcomes among more than 4,000 births from 2001 to 2011, so that's a 10-year study, that were between 22 weeks and 24 weeks of gestation at 11 centers in the United States. The authors reported that the rate of survival and survival without neurodevelopmental impairment increased over this period, whereas the rate of survival with such impairment did not change, arguing that the observed overall increase in survival was not simply a trade-off for life with significant impairment, but the absolute change in survival without impairment was just 4%. However, and the most neonates in the most recent 2008 to 2011 epoch died, which was 64%, or were severely impaired, which was 16%. If you'd like those statistics, Representative Batista, I can do them now. That is the end of my thing. Would you like them or no?
I thought if you have like...
I have like 4 little bullet points on it, if you'd like.
Sure, please.
Okay, sorry, I just don't want to take up too much time. So the Turnaway study that Gretchen mentioned, women who were turned away and went on to give birth experienced an increase in household poverty lasting at least 4 years relative to those who received an abortion. Years after an abortion denial, women were more likely to not have enough money to cover basic living expenses like food, housing, and transportation. Being denied an abortion lowered a woman's credit score, increased the amount of debt, and increased the number of their negative public financial records, such as bankruptcies and evictions. And so that is the statistics financially, what that would look like for women who are denied access. Thank you so much for your time.
Okay, any questions of the witness?
Thank you, Jackie.
Okay, you can go.
Hi, my name is Jocelyn Foy. I am the Executive Director to the Woman Project, and I also am one of the organizers to the Campaign for Equal Abortion Access. We are a series of not-for-profit organizations of around 42 that have come together, like the Rhode Island Coalition for Reproductive Freedom, to all band together and say that we believe in the rights to all Rhode Islanders to have access, and we hope that you agree with us. So the Woman Project, who I'm the executive director of, we are a statewide organization focused on leveraging the power of art, activism, advocacy, and education, advancing the principles of reproductive freedom and justice. The concept of reproductive freedom and justice demands that we all have the right to determine when and how we build our relationships, our families, our futures, as well as we have the ability to live and raise our children with dignity. So I have submitted a large piece of testimony. You all have documentation of that. I thought I would save you time so you don't have to hear the exact same things over and over again in respect. But I just want to say that we all worked so hard to pass the bill in the 2019, the Reproductive Privacy Act. And we're at a juncture where we are often saying to most of the people we work with and talk to that this bill is not about abortion as much as this is about everyone being treated fairly, which is why you're seeing so many individuals coming forward from more diverse organizations than ever before. And we hope that Rhode Island can actually set a path forward for so many states in the nation that are turning to Rhode Island and saying, what is the example that we can show our states? Rhode Island has that opportunity to be that representation. There aren't many good stories to be spoken of this kind of care. So, and this, I should say this year. So what I would like to do is just say, please vote yes on H5006, and please vote no on H5047 and H5225. Let's close gaps to access and abortion so everyone can be treated equally and given a chance to choose what dignity of raising a family looks like to them. Thank you for having us.
Any questions for the witness? Seeing none, okay.
Thank you.
Let's see, is there anyone else that I need to bring forward? Donnie Anderson, why don't you come up?
Thank you, Chair. I'm the Reverend Dr. Donnie Anderson. I'm a Providence resident, and I'm here today proudly as the newly elected chair of the Rhode Island Democratic Women's Caucus. The caucus has consistently taken a stand in favor of the Equality of Abortion Coverage Act. As has already been pointed out, this is not about a right. This is about access and everyone having access. And I don't want to reiterate things that have already been said far better than I could say them. I would like to, however, point out, build on one additional point that Secretary Amore raised, and that is this, that we do not have the right in this country to stipulate what we want our taxes to go for. And we need to repudiate any thought about that. Let me give you a personal word on this. There is conversation going around this country to suggest that just as people who do not believe in abortion want to restrict how their tax dollars are paid, that same thinking is being applied to transgender rights. And I need to share with you, if you want to see death, then start denying young people ability to transgender rights, and we'll see a whole new series of epidemic proportions. I ask you on the basis of fairness and also on the basis of please take a stand and kill this concept in Rhode Island that people have a right to choose how their tax dollars want to be spent. That is wrong, and we strongly urge you to support this bill, move it out of committee, and make it so in Rhode Island. Thank you.
Any questions for Donnie? Thanks, Donnie. And there's one other witness, and I'm going to turn it over to the first vice chair. Is Emily Crowell from the mayor's office here? Emily? Not here? Oh, okay. Well, she can come forward, and Representative McEntee will deal with her. Chairwoman McEntee. You can go on to the rest.
Thank you, Mr. Chairman. Next, we have Wiona Nelson Davies. Oh, and who are we looking for?
This is Emily Crowell.
Emily Crowell. Hi, Emily. And we'll bring up one more. I don't know how to say this name, but I'm going to try. Olga Chukui Ezeki? No? Okay. Sorry about that. And Anna Wellen? Did we already hear from her? We did her already. Okay. John Wellesley? Okay. Emily, if you'd like to start.
Is it on? There we go. Thank you, Vice Chair and members of the committee. I'm here in both a personal and professional capacity. First, I serve as the Chief of Staff to Mayor Brett Smiley, who's unable to be here today but has submitted a letter of full support. I'm here to express his full support of the EACA. As a former board member of Planned Parenthood, he knows the importance of accessible and affordable access to reproductive and sexual health care. I'm also here in a personal capacity. As many of you may remember, I was the vice president of Rhode Island Now when we all collectively worked together to pass the RPA. I also served as the state of Rhode Island as an employee during COVID-19. I find it mind-blowing that while I was a state employee, working incredible hours to set up testing and vaccination sites to support our students and our teachers, I myself would not have been covered for an abortion through my provided health care, should I have needed one. I'm a healthy 35-year-old woman who has access to a multitude of birth control options, but still often thought of what may happen if I needed access to this type of health care. I can only imagine how folks who are covered by Medicaid, particularly the 77,000 women of childbearing age, may feel. I know, and I've worked with many of you, and I hope that you will seriously consider supporting people like me, the entire staff of the state of Rhode Island who works tirelessly for us every day, and the thousands of people covered by Medicaid, and support this bill. I also urge you to vote no on H5047 and H5228. These are both terrible bills that introduce vague language that provides no additional safety or security to women or children and create ambiguity that will negatively impact pregnancy-related care. These bills are unnecessary and misguided policies. Thank you for your time and your consideration.
Thank you. Any questions of this witness? Hearing none. Next.
Thank you. First Vice Chair and members of the Judiciary Committee. My name is Wiona Nelson Davies, and I'm the Executive Director of the Economic Progress Institute. We are a nonpartisan research and policy organization that advocate on behalf of the economic well-being of Rhode Islanders. And we are here in strong support of Whip Kazarian Bill 5006, the EACA, and for a few reasons. One, this stops discrimination against low-income Rhode Islanders who are on Medicaid and discrimination against state employees. The Reproductive Privacy Act of 2019 protects the rights of abortion, except it excludes a subset of Rhode Islanders, and that is not right. This also promotes reproductive justice. We should all have the right to bodily autonomy, including the right to make decisions about when and whether to have children. Legislators, lawmakers, taxpayers should not have the right to decide what kind of care someone has. The dignity of all people should be respected, where they work or how much they make. This also values economic, racial, and healthcare justice. Medicare recipients who will be impacted by these decisions are over 77,000 people, most of them Black and Latino Rhode Islanders. Reproductive care is a part of our healthcare system, and that does not operate in a vacuum. The lack of access to health care, including abortion care, has a ripple effect on other financial decisions someone has to make in order to meet their basic needs. And finally, A right without access is not a true right. The RPA has not done what it was enacted to do if everyone does not have access to it. It should not depend on how much you make or whether you are reliant on public insurance program. Our history as a nation and as a state point to public policies that have excluded different groups of residents from equal access, such as housing, social security, education, and more. As we fight for healthcare rights, may the lessons of the past cautious us when we come to exclude certain members of our society. And reproductive care is one of those that we need to pay attention to now. We would like to see this move out of committee and onto the floor for a vote for equality in abortion. And we thank you for your time here today.
Thank you. Any questions of this witness? And John, you're next.
Thank you, Madam Vice Chair. My name is John Wesley. I'm the Director of Policy and Advocacy at the Rhode Island Coalition Against Domestic Violence. Through our member agencies, the coalition serves thousands of victims of domestic violence every year in Rhode Island, statewide. Before my role at the coalition, I was a legal aid lawyer representing many victims and survivors of intimate partner violence as well. We are here this evening in strong support for House Bill 5006, the Equality in Abortion Coverage Act. Restricting access to reproductive health services and choices places particularly dangerous burdens on victims of domestic and sexual violence. Victims of domestic violence are at a significantly higher risk for unintended pregnancy because abusers will often sabotage or interfere with their partner's birth control in an attempt to exercise full control and power over their reproductive decisions. In a study that was conducted jointly by the University of California, Davis School of Medicine and the Harvard School of Public Health, researchers found that at least 35% of domestic violence victims reported some form of reproductive control by their abusive partner, either through contraceptive interference or coercion to become pregnant. All victims of domestic and sexual violence, including those who are on Medicaid or happen to be a state employee, deserve to have all access and coverage for abortion health care. Restrictions that bar or complicate access to abortion provide additional leverage for abusers to use in order to threaten or intimidate their victims into continuing with an unwanted pregnancy. An unintended pregnancy allows an abusive partner to be connected to their victim for decades, and further opportunities to re-victimize and attempt to control the survivor for years on end. Given the executed threats to reproductive freedom and gender equality at the federal level, and now in many other states across the country with the reversal of Roe, the Rhode Island General Assembly must act this year to ensure that all Rhode Islanders, including victims of domestic and sexual violence, have inclusive access to health care coverage for all of their contraceptive and abortion services. We thank you today, and we ask the committee to pass this legislation as soon as possible. Thank you very much for the time.
Thank you, John. Representative Baptista, did you have a question?
No. No, not a question. I just, somebody mentioned the diversity that exists within all of the advocates here today, and I recognize all the different things that you folks do, and I want to thank you for that. I'm a little bit partial to Emily. Thank you for your service to the City of Providence and for taking time out of everything that you all do in your normal 9 to 5 to come here and testify on behalf of this very important issue, so thank you.
Thank you.
Thank you. Next, Eric Hasselhurst, Megan Smith, and Amber Young. She's not here? Not here. Bella Robinson. Is Bella here? Go ahead, Eric.
Is it on? Yeah?
Yes, I think so.
Thank you, Chairwoman, Representatives. Eric Hasselhurst. I'm here today on behalf of the National Association of Social Workers, Rhode Island chapter, in support of Whip Kazarian's Bill 5006, the Equality in Abortion Coverage Act. The National Association of Social Workers is the largest membership organization of professional social workers in the world, and work to enhance the professional growth and development of its members, to create and maintain professional standards, and to advance sound social practice. The NASW has a code of ethics, which are a set of standards that guide the professional conduct of social workers. And these ethical principles are based on social work's core values of service, including social justice, dignity, integrity, and competence. And these principles set forth ideals to which all social workers should aspire. Core among this code is the value of dignity and self-worth, and the ethical principle that social workers respect the inherent dignity and worth of the people that they serve, and will promote their clients' socially responsible self-determination. This self-determination includes the right to abortion, which means abortion must be accessible. In Rhode Island, we can do this by passing this legislation to include abortion coverage for state employees and those enrolled in the Medicaid program to allow for true insurance coverage parity. Thank you.
Thank you, Eric. Any questions? Seeing none. Doctor, you're next.
Good afternoon. Is this on?
Let's see, are you talking to it?
Good afternoon, members of the committee. My name is Dr.
No?
No.
Yeah, no, it's not on.
It is. Pull it closer. There you go.
The red light is on. Sorry.
Okay.
Technology. My name is Dr. Amber Young, and I'm a resident physician at Women and Infants Hospital and a future maternal fetal medicine specialist, which is high-risk obstetrician. In my future, I will be specializing in both maternal and fetal care problems, and I'm here to strongly support House Bill 5006. As a physician, I have the privilege to care for patients seeking reproductive health services throughout their lives. We talk about birth control options, we talk about healthcare screening to prevent cancer. I provide pregnancy and postpartum care, and equally important, I provide abortion care. Abortion is a central component of healthcare, and decisions regarding reproductive health care should be made by patients in consultation with their clinicians and without undue interference by outside parties. Like all patients, individuals seeking abortion are entitled to privacy, dignity, respect, and support. When somebody needs to end a pregnancy, it is imperative that they have the means to see a licensed, trained, quality provider so that they can hear about the options that they need, whether that be a procedure or medications. That decision is unique to each patient and their family, and they should be able to make that decision. The EACA will treat all Rhode Island residents equitably by adding coverage of abortion to our state Medicaid program, as well as allowing the thousands of state employees and their dependents to have access to abortion services. I strongly urge you guys to vote yes on House Bill 5006. We should support each person's ability to consider what is best for them, and we should not put up obstacles that interfere with people's access to full reproductive rights. Thank you so much.
Thank you, Doctor. Any questions? Seeing none. Bella, you're next.
Is my mic on? Hi. Thank you so much for listening to my testimony. I want to thank the sponsors of the bill, the Women's Project, and everyone who's advocated for the EACA for the last few years. I am here in support of it. My name is Bella Robinson. I'm a representative of Coyote RI. We are a group of sex workers, former sex workers, trafficking victims, and victims of police-sponsored domestic violence who are organizing to promote public health and safety for our community. And I want to tell you two quick personal stories. Just last month, my 31-year-old daughter, birth control failed due to COVID. She had to have an abortion. Had she not had the money, she wouldn't have been able to afford to. She was very lucky. I had an abortion when I was 19 in the mid-'80s. As I left the abortion clinic, pro-lifers followed our car. This was back when they bombed abortion clinics. They burnt the one in St. Petersburg, Florida, down to the ground. And not only am I opposed to the anti-abortion bills that are not, in my opinion, based in reality, I wonder when we have to worry about people with guns coming to abortion clinics and why this is our healthcare rights and the control over my body is anyone's business. And I don't care if you're pro-life until you want to criminalize other women for not believing in your beliefs. Thank you, and I'll be willing to take any questions.
Thank you very much for your testimony. Any questions? Thank you. The next three are Emily Crowell, Jack. Oh, she did? Jackie Anderson. She already went. Georgia Hollister Isman.
Just call her.
Georgia. Okay. Patrick Crowley. He's not here?
He's here. There are people in the...
Oh, okay. All right. Angela McCalla from Women's Fund of Rhode Island. Did we already?
That's Georgia.
Oh, there's Georgia.
There's Patrick.
Angela, is that you?
Yep.
Yes.
Okay, come on up. No, this last one I know. Go ahead, Georgia. You can proceed.
Is the microphone on, or am I need to press
You're on.
it?
Just pull it a little closer.
Pull it closer, yeah.
Thank you so much, Madam Chairwoman, members of the committee. My name is Georgia Hollister Isman. I'm the New England Regional Director for Working Families, and I'll be brief, but I just want to express our strong support for the EACA. As some of you maybe remember, we've been testifying in support of abortion coverage for people who receive their health insurance through Medicaid and through the state employee plan for a long time. It was an issue of important economic justice then. It is now. Not much has changed here in Rhode Island, but all around the country, people have been losing access to abortion, and this is an important moment for Rhode Island to show leadership about what it means to take the lives and health of all the women and people who can become pregnant here in our state seriously. So it's time, and I urge you to pass this bill this year. Thank you.
Thank you, Georgia. Next.
Thank you. My name is Angela McCalla, and I am the Policy and Advocacy Program Director for the Women's Fund of Rhode Island. Our mission is to empower women and girls through advocacy, research, grant-making, and strategic partnership to achieve equity through systemic change. We are here today to advocate for House Bill 5006, the Equality for Abortion Coverage Act. Access to reproductive health services remains dependent on the type of insurance that a person has. It is not enough for us to say some people may enjoy these privileges while others may not. The loss of protection at the federal level makes access to abortion care even more limited, particularly for our Black women, people of color, and other pregnant folks struggling to make ends meet. At the same time, we are also seeing the U.S. maternal health outcomes worsening for these same groups. These emergencies stem from historical and ongoing racism that has been tied to the U.S. legacy of birth control and coercion. Consider this. 10.6% of Rhode Island residents live under the federal poverty level line in 2020. The cost for abortion is at least 72.7% of the median monthly rent in Rhode Island and 25% of the monthly per capita income. The cost for abortion is approximately $650, not including lost wages, childcare, special needs, or transportation. Approximately 330,000 Rhode Islanders could not use health insurance to cover abortion care. And 26% of Rhode Island women aged 15 to 44 years old are insured through Medicaid. According to the Planned Parenthood of Southern New England poll, 66% of Rhode Island voters support the EACA, and 72% of Rhode Islanders with health care coverage through Medicaid or the state should receive the same coverage for abortion services as those insured by private health insurers. There is a clear correlation between abortion restrictions and poor maternal health care outcomes. Let us acknowledge that pregnancy can be deadly for some people, with the cause being racism. Inequitable access falls hardest on our Black and Indigenous women population, as well as other birthing people. These challenges can be eliminated by ensuring Medicaid and state health insurance users can use their plan for abortion care. We are grateful for the work our past legislators have accomplished, and we are looking for our legislative champions to lead and eliminate barriers for those who need it most. The Women's Fund of Rhode Island would also like to stand and strongly oppose House Bill 5047, House Bill 5228, and House Bill 5573. Thank you.
Thank you, Angela. Patrick?
Thank you, Madam Chair. Can you hear me?
Yes.
Thank you. My name is Patrick Crowley, and I'm here today representing the members of NEA Rhode Island, many of whom already are covered by insurance plans that do provide abortion coverage, but we also represent a few thousand state workers who do not have this coverage. And for us, this is an equity issue. Across the country, we've seen the attacks on abortion care, and in particular on abortion care for people at the lowest income stratus. But in Rhode Island, one of the unique reasons why we're in support of this bill is we worked very hard back in 2019 to pass the Reproductive Health Care Act as a whole, even knowing that it wouldn't protect our members. So we feel as if it's our duty not only to speak up for the rights of all working people, but especially on this issue. You know, as someone who's been involved with state negotiations for the last 15 years for public sector workers, you know, it was ironic. I think the last time I heard someone mention this was in the last group of panels, the doctor who spoke. It's not just the state employees that are impacted by this prohibition, it is their dependents.
That's true.
And that's a group of people that, you know, are impacted by this law who are not directly impacted by the intent of the laws when they were first passed. So I think one of the ways we can spread this justice is by making sure that Rep. Kazarian's bill is enacted into law. I'm going to be happy to answer any questions.
Thank you, Patrick. Any questions? Seeing none. Thank you for your testimony. Next, we have Mary Chase from the League of Women Voters. Reverend Jean Dezlewinski. I know I just killed your name, but. And Lisa Church. Mary, you want to start it off?
Oh, all right. Is this on?
Yes.
Can you hear me? Thank you very much.
Pull it closer to you, so
okay.
if you can.
Thank you. Thank you very much for hearing our testimony today and for your consideration of all the bills that you do here. Again, I'm a representative of the League of Women Voters of Rhode Island. The League strongly supports the EACA 5006. The League this is a national organization. We also have a local chapters and state chapter as well, but it represents the 52 states. And the League strongly believes that the health coverage should be accessible and affordable for all citizens. And it should include an equitable distribution of services, including services for abortion. Now, I am not going to repeat all the amazing testimony that's presented before, which I certainly support. But I would just like to add one thing. In reality, as it exists now, that is current law, it serves the same purpose as laws in states such as Texas and Mississippi, which have extreme abortion bans, since Medicaid recipients often cannot afford the cost and therefore forego this health care. Long-term costs to the state due to unintended pregnancies resulting in birth costs all taxpayers when the child cannot be supported by the parents. And of course, the parents suffer because so often they go into bankruptcy. I mean, they can go into bankruptcy. And that's not meant to be a hard kind of thinking. It's a compassionate thing. It's not just thinking of the dollars, but we do have to consider the expense of caring for children who cannot be cared for by their families. The League's national position is that it is a constitutional right for a woman to make her own reproductive choices. Accessibility to abortion is part of that. And I strongly urge you to pass this bill out of committee. The League would also like to oppose H5047 and H5228, also 5573. their attempt to block abortions by legislating what is appropriate care, whereas it should be left to the medical profession on certain bills here to define care.
Thank you.
The bills before you include detailed restrictions where the judgment of appropriate care is left to the legislative interpretation of the circumstance. The possibility of severe criminal penalties put doctors and other medical care professionals in a very difficult position in how to respond to complex medical situations. The medical profession has its own guidelines and ethics, which is based on scientific evidence and governs its members. So I would like to ask also that you oppose these bills.
Thank you, Mary. Reverend Jean, you're next.
Thank you.
Can you tell me your last, give me the correct pronunciation of your last name.
Reverend Jean Dishlevsky.
Dishlevsky. Did I get it right? Dishlevsky?
Yes. For
Thank you.
reasons that are beyond me, most people just refer to me as Reverend Jean.
I think I'll be one of those.
I'm a church pastor, and I'm the chair of the Religious Coalition for Reproductive Freedom. And I'm speaking in support of 5006. Actually, I will be brief, but I would like to, I did bring comments from a number of my colleagues. As you may know, some of my Jewish colleagues will not be here tonight because this is the Feast of Purim, and they're attending to religious observances. I brought this in, gave it to the clerk, and I'm hoping at some point it could be distributed now or later for you to read at your leisure. Is that better? Some of these folks are far more articulate than I am. In any event, my main concern is on inequality. Funding restrictions on health care present an impediment to decision-making concerning health issues for many individuals with limited means. Insurance is as meaningful and valuable as the coverage it provides. And we can't be indifferent to the fact that these restrictions have a disproportionate impact on low-income people. Many of these folks who are low-income are struggling in any number of ways. The restriction is not just another unnecessary burden. It limits and may remove the ability of some of my congregants to be able to choose if they have a child, when they have a child, how many children to have. Everyone should have the freedom to make prudential decisions about childbearing, child rearing. Having children requires resources, not just financial, but time and attention. It is insulting and oppressive to poor people to continue this restriction. So I urge passage of this bill. Thank you.
Thank you, Reverend. And Lisa?
Hello. Chairwoman McAtee, honorable members of the Judiciary Committee. My name is Lisa Church of Smithfield, Rhode Island. I'm a constituent of Representative Costantino. This is on, right?
Yes.
Good. I'm also an employee of the state of Rhode Island. I am opposed to House Bill 5006, and I support House Bill 5047 and House Bill 5228. I am opposed to using taxpayer funds in premiums from my self-employed health insurance plan to pay for abortions other than those that are already permitted under the existing law. I was stunned to learn that the state conducted a fiscal study last year and estimated a potential cost savings of approximately $5.4 million from taxpayer funds under identical legislation. The fiscal note compared approximately $400 for the cost of an abortion to anywhere from maybe $12,600 to almost $14,000 for the cost of delivery, advocating for the cost savings of abortions to the state, which I found abhorrent. Personally, I am the mother of a special needs child. None of the usual prenatal screenings showed any concerns, nor did our family history. We were stunned at the birth of our child. The diagnosis, the treatment, and the prognosis was shocking to us. But over time, I became confident that I'm capable of caring for this child. I can do this. House 5006 tells me that I should have aborted that child, and that child should not have lived. That child has a face, a name, an identity, is a member of my family and a member of many communities. And this legislation tells me and that child that we should have aborted the child. Just think of all the money the state could have saved. I urge you strongly to vote against H5006, support 5047, 5228, and I would advocate that instead you support our most vulnerable citizens with investments in quality health care, employment, child care, and housing, instead of proposing the killing of unborn children of the poor as a solution to poverty. Thank you.
Thank you, Lisa. Next, we're going to bring up the next three. Jeremy Langell, Denise Webster, William Mintz. Does that look like Mintz? No, Roland Eugene Thoreau. Are you here? Jeremy, is that you?
Yes.
All right, why don't you start?
Thank you. Good afternoon. My name is Jeremy Langell, and I live in Warwick in District 22. I am a philosopher of religion and theology, and prior to my current position as a philosophy professor, I served as a minister in various religious settings for about 20 years. I am here to voice my support for House Bill 5006. There is no shortage of religious views when it comes to the medical question of abortion. Some Christians, for example, point to the authority of religious texts in order to develop and justify their moral reasoning against abortion. The issue, of course, is that religious texts, like the Hebrew Bible or the New Testament, provide no direct prohibition against abortion. In fact, some texts, Exodus 21, for example, seem to suggest an ontological difference between person and fetus. That text deals with the case of a woman who has had a miscarriage because of an accidental physical conflict between two other persons. And the punishment meted out differs dramatically for the pregnant person and the fetus. If the pregnant person is injured or dies, the corresponding punishment against the assailant is an eye for an eye, or a life for a life. For the miscarried fetus, the punishment is the payment of a financial penalty. In other words, the text identifies the woman or the pregnant person as fully human and the fetus as a kind of property. My point in illustrating this passage is not to get wrapped up in the contextual analysis of religious texts. For one, we know that abortion, as a medical practice, has been around since ancient times. This fact alone prompts one to consider why, if abortion is such a thorny issue now, that so few ancient religious authorities provide in-depth or sustained theological analysis of its practice then. More to the point, what I am attempting to show here is that religious considerations of abortion are wide-ranging and diverse, and at the end of the day, not particularly relevant when it comes to the true question at hand, that is, making sure that all Rhode Islanders have access to abortion as a healthcare right. An astute observer of the religious text I discussed earlier would note that the previous example covered accidental miscarriage. They might suggest, for example, that a different kind of moral consideration could be applied in cases that were not accidental. In terms of religious conversation, I expect that would be a vigorous debate. And it would be a fundamentally religious one, where sincere and committed religious individuals could still come to disparate and fundamentally different conclusions. And all of that, while interesting as it relates to religious discourse, fails to acknowledge that while a person may have a religious view that informs their activity in the world, many others do not, and do not have to share those same perspectives. Although I have never personally been pregnant, I know from my own experience as a father and as a person who pays attention to the medical field that abortion is about health care. It is about making sure that in some of the most difficult and painful outcomes that can occur in a pregnancy, that a person has the full bodily autonomy to make medical decisions that are best and right for them. As a religious scholar and a person of faith, I encourage this committee to pass this legislation to ensure that all Rhode Islanders, regardless of income or any other status, have access to abortion as a fundamental health care right. Thank you for your time.
Thank you. Next, Denise?
Yes. Is that on?
Yes.
It's on?
Well, no, they don't have up and down on this. No.
Is that on? Oh,
You're on.
Thank you. My name is Denise Webster, and I am from Bristol, Rhode Island. I have been in this state my entire life, and never thought I would be sitting here, but I also was here and testified in 2019 about the abortion bill, and I just have questions. One of the questions I would like to begin with is, where are we headed with this issue? Because if we cannot validate and value the unborn who are vulnerable and have no say, where are we going with this? Who will be next on the list of unfortunate circumstances or too many resources are needed to keep this person going? I really wonder. And frankly, it's very scary because they weren't happy with what they did in 2019. They weren't happy. So I'd like to I think if we want to know where we're going, we might want to know a little bit about where we've been. And really, matter of fact, I don't believe in any testimony that I have heard in 2019 or today has talked about the history of Planned Parenthood. I'm sure people know who started family planning, which became Planned Parenthood, which is Margaret Sanger. And we all know that she had children of her own. However, she was a eugenicist. And she was so well known that her services, her knowledge was requested by the German government in World War II to plan experiments on the prisoners in the concentration camps. Then we move forward to 1973, where we have Roe v. Wade. Well, was there an abortion in Roe v. Wade? I ask everyone.
No.
Was there an abortion on Roe v. Wade?
No.
For those who don't know, the answer is no. You can look this up on the internet.
I had to read it.
Her name is Norma McCordy. She was a young college student who was solicited to act as the person having the abortion in this lawsuit. However, she never had an abortion, and she did have her child in another state. So, and also in that particular case, the Supreme Court ruled that with the knowledge that they had at the time, that this question would be revisited again. And I can honestly say that we certainly have a lot more technology today than what was back in '73. So here we are, 50 years later. After that, 65 million plus, who knows what the real numbers are, million deaths of children. I sat here in 2019 and I listened to people say that 1 out of 4 women have an abortion in this state. So I ask the people that are sitting here who are for this, count every 4th person in this room randomly, and you're not here. You didn't have a choice. How many lives, how many intelligent people have we decided to destroy? And certainly not in a nice way at all, and I could use other language, but the fact that abortions are saline, which is a burning of the entire body in the womb. There is also dismemberment of the body.
Excuse me, ma'am. Yes. We should stay to the issue of whether or not you believe that it should be. The bill is talking about whether or not healthcare should, the healthcare insurance companies should pay for state employees if they choose to have an abortion. We're not here to well, you can discuss it. Obviously, it's clear what your view is, but we're not here to litigate or the issue of whether or not abortion is legal in Rhode Island.
Okay, I would just like to say one more thing, and then I'll wrap it up.
Thank you.
Okay. In 2019, this bill that was heard by, I don't know exactly which members might have been on this committee in 2019, who had heard hours and hours and hours of testimony and hours of written testimony, and to, at the very last minute, the 11th hour, to have that taken away from this committee and given to another committee who would rubber stamp it.
That was in the Senate, not in the House. That happened in the Senate version.
That was the Senate
the House,
version?
we heard it in Judiciary, and it stayed in Judiciary.
Okay.
And it passed out of this committee and then went to the floor.
Well, I think it was unfortunate the way it was handled, you know, regardless. So I wish that people would consider that there is adoption available for those who cannot afford it or who change their mind. And so therefore, in House Bill 5006, I would be against that. House Bill 5047, I would be for it. And House Bill 5228, I would be for that bill.
Thank you.
Thank you.
The next 3 witnesses, William Mintz, Roland Eugene Thoreau. I've called both those names before. Nancy Green, Jean McDonnell, and Nathan Emery. Please come forward. These 3. 1, 2, 3, 4. Oh, I didn't. Who's this guy?
Sir?
Oh, what was your name?
You're Mr. LaRue.
Oh, okay. Sorry, I'll call you next. I'm sorry. I didn't know you were here. Okay, so Mintz, we don't have. No, sure. Okay, Ronald, if you want to start.
Hi, welcome everybody. kind of taken back by this bill. So I am man Ronald Eugene LaRue, came to being in the state of Rhode Island, and I'm representing a lot of pastors, the Ernie Robillard, and a lot of the Hispanic pastors in the state of Rhode Island who couldn't be here today, made claim and that this bill attempts to commit trespass by legislating murder of innocent children, that the above named have grossly violated their oath of office, God's law, the Rhode Island Constitution, and are in divers ways trying to legalize immoral, reprehensible, and criminal conduct by repealing and replacing statutes to supersede God's law, the Rhode Island Constitution, which is supposed to be the supreme law of the land. Our position is this is conspiracy to commit murder by laws, acts, and statutes. You had some pastors or people who claim to be pastors come up before this board or you people and claim that there's nothing in the Bible that says anything about unborn children.
Ronald, can I ask you, I appreciate that you're against abortion. Can I ask you how you feel about the public funding of abortion?
I would never pay taxes again if you did that. You know.
That's great.
And I would go to jail if you tried to make me pay them.
I would just ask that you confine your. The issue today is not about the actual thing, and
right,
just like let me speak. The issue today is not about the legality of abortion. That question is settled in the state of Rhode Island.
No, it's not, sir.
Yes,
it's illegal. It's immoral. And when I get to the Constitution, I'll show you that.
I'm not asking you to get the Constitution. I'm just saying that the issue that we're here to talk about today is whether or not government funds can be used to facilitate abortion for folks on Medicaid or people with a state-sponsored insurance plan.
I understand that.
I'm asking you to confine your comments to that issue if you can.
That's going to be very difficult because we're making a claim against you people for violating the law. All right, we're going to press this in a court if we have to. So, the Rhode Island Constitution clearly states, "We, the people of the state of Rhode Island, grateful to Almighty God for the civil and religious liberties which He has permitted us to enjoy, looking to Him for a blessing upon our endeavors and to secure and transmit the same unimpaired to succeeding generations, do ordain and establish this Constitution." That Constitution is sacredly obligatory on all. So this bill should never even be before you. The Rhode Island Constitution clearly states that. It says, "In the words of our founding father of this country, we declare that the basis of our political system is the right of the people to make and alter their constitution of government, but that the Constitution, which at the time exists, still until change, shall be explicit and authentic, and the acts of the whole people is sacredly obligatory upon all." Article 1, Section 2 of the Rhode Island Constitution says no right to abortion granted. Article 1, Section 2 also says no person shall be deprived of life. Nothing in this section shall be construed to grant or secure any right related to abortion, nor the funding thereof. So you're violating the Rhode Island Constitution when you try to use funds for abortion. Now, let me get to this other section here. Your own Rhode Island General Law, 1123-4, the willful killing of unborn. The willful killing of unborn quick children. The administration of any woman pregnant with a quick child of any medication, drug, or substance, whatever, or the use of the instruments or device or other means with intent to destroy such child shall, in the event of death of such child, be prosecuted, be deemed guilty of manslaughter. Quick child. For the purpose of this section, quick child shall mean a...
Excuse me, Ronald, right?
Yes.
Is that you're really getting off the topic of the bill. I mean, we're talking about financing.
I understand that you can't finance something that's illegal.
Okay,
and
so you're well over your
violating
time
your oath
limit.
of office. All right, you're violating your oath of office. You're violating the Constitution, and you can be held liable for this.
Okay, but you have taken more time than allotted.
I've sent this whole thing to each and every one of you. I've sent it to I've sent it to the people who sponsored this
And we
bill.
will read it.
And you will read it, but what you're not going to do is what you did to us last time when you desecrated marriage, and we sent thousands and thousands of
All right.
thousands
We're
of
not going to
thousands
get
of-
into that topic.
I know,
That's
but
not
listen,
in
we
front of us.
sent-
So
right, we sent thousands of petitions or letters in asking you not to do that. and you
Okay,
did
well,
not listen
that is
to
not
us.
the topic for today, so thank
I
you for your
understand that.
testimony.
I understand that.
Okay, Nancy?
Okay. Thank you for the opportunity. Oh, excuse me, is the mic on?
Yes.
Thank you. Thank you for the opportunity to testify in favor of Bill 5006. There are two terms that can help clarify the issues around this, and one is financial triage. Financial triage is when our access to health care depends on our income or our zip code. And what we currently have is financial triage of access to health care. The other useful way to look at it is reproductive justice, which was stated very eloquently by the representative from Sister Fire. Sister Fire is an organization founded to address the terrible disparities in health outcomes for Black mothers and children. The infant mortality and maternal mortality that is higher in the Black community, that is a disparity we should not accept. That is completely unacceptable. A majority of Rhode Islanders support reproductive rights, including the right to safe and legal abortion. We also support prenatal, postpartum, and infant care and preventing unwanted pregnancy. Bill H5006 includes enhanced health care coverage for prenatal and postpartum care, social services, and family planning services for up to 2 years after delivery. It gives women on Medicaid the same abortion coverage as those who can afford private insurance. Whether or not to become a parent is not an inconvenience. It is a life-changing decision. Should we use Medicaid denial as leverage to pressure some people not to have an abortion, regardless of whether they want to be parents? We should instead work for equal access to health care for all Rhode Islanders. Please support this bill, which remedies an inequality in coverage and improves coverage for families. Thank you.
Thank you. Thank you very much. Jean?
Vice Chair and members of the committee, I express my, is it on? Am I on?
Yes.
It's okay. I express my strong opposition to 5006 and any bill or policy which would force every taxpayer in Rhode Island to fund elective abortions. This is a serious attack on religious liberty, and it's an egregious overstepping of the state government's denying the rights of Rhode Islanders. Catholics and people of other faiths, as well as those who recognize the humanity of the unborn because of the scientific fact that the life of a human being begins at the moment of conception,
Amen.
should not be forced to violate their faith practice or their principles by being forced to pay for anyone's abortion. In the practice of their faith, Catholics are required not to perform an abortion, not to procure an abortion, and not to provide material assistance for an abortion. Paying for an abortion is material assistance. This would violate the religious liberty of your fellow Rhode Islanders. Pro-abortion proponents have often labeled themselves pro-choice and that it is an individual's right to decide for themselves if they support abortion. Well, where is the choice for pro-life Rhode Islanders if the state government decides to force every taxpayer to support and pay for abortion against their will? I ask you, each one of you, do you believe that medical professionals have the right to choose not to perform or assist in abortion? Do they have a choice? If you think that they do, then why would you not also recognize the right of all your fellow Rhode Islanders to exercise their right to choose not to be a party to abortion, not to be forced to support and fund it against their will? If you think that medical professionals should be required to participate in abortion against their will, then you should readily admit that for pro-life proponents, in your view, choice is a facade and a fiction. And you support forcing all Rhode Islanders to support and fund abortion against their will. Proponents of abortion often point to the hard cases to sway public opinion. Let's be clear. The removal of an ectopic pregnancy is not an elective abortion, nor is cancer treatment during pregnancy. And the vast majority of abortions are performed with no medical condition at issue. I also raise the issue about taxpayers and not having any control over what we pay for and what our commitment is. I would point out to you that there is precedent in our nation's history. During World War II, Quakers and other people who objected to combat service were offered alternative ways of service in recognition of their faith commitment to pacifism.
Yes, we have time.
Provisions should be made so that folks who oppose abortion and do not want to violate their religious beliefs or their principles by being forced to pay for it should have an alternate way, not pay taxes to the state of Rhode Island, and in lieu, make a comparable contribution to organizations that provide regular service to people, after-school programs, keep the heat on. No one should be forced to pay for anyone's abortion against their beliefs. Please be fair. And as regard the legality, just because some actions have been declared legal does not give the government the right to force anyone to support and fund such actions. People can choose to drink or gamble, but I can't be forced to buy their liquor or their lottery tickets. And I would also point out, folks here who mentioned these cases, individual cases that they seem to be very well aware of, and people in financial need. Not one of them stated that they opened their wallet and helped those people, but yet they would demand that people who have serious objections to abortion should just roll over and pay for abortion against their will. This is an egregious overstep, and I hope that should this legislation proceed, there would be legal action taken against this.
Oh, it will. Thank you. The next it's Nathan Emery, Danielle Pimentel, and Danielle, yes, and Terry Cody. Nathan, you want to start?
If I may. Well, thank you for this time, committee, and thank you, Chairwoman.
On?
It should be on.
Then listen, for everyone who's going to get up here, you got to get it like within an inch.
Like here? Is that good?
You got to pull it right up to your mouth.
This is uncomfortable.
Don't worry about it.
Okay. Well, this issue is very personal to me because although I obviously have never had to be put in a position where I need an abortion, I know several family members who have, including immediate family members who have, against their will, had to have abortions done because they simply cannot bear to have a child economically. And for all those who say, slaughtering of the unborn is the worst thing. Well, what about a child growing up in a broken household without resources for them to grow up properly? You know, people care all about the unborn, but once they are born, they seem to not want to offer them any kind of care. So to all the people in opposition to 5006, may I ask, will you support free childcare, free housing for children, health care for children? And I believe strongly that there is no such thing as an abortion out of convenience, because people who have abortions have a reason that is necessary. If they are poor and cannot handle having a child, then having an abortion is the most responsible thing they can do.
Thank you, Nathan. Next, Danielle.
Good afternoon, Mr. Chair, Vice Chair, and members of the committee. My name is Danielle Pimentel, and I serve as Policy Counsel at Americans United for Life. And I want to thank you for the opportunity to testify today. Today, I'm urging the committee to support HB 5047 and to oppose HB 5006. And I will be brief as possible. This bill, speaking of HB 5047, would ensure that born-alive infant survivors receive perinatal palliative care to increase their chances of survival and alleviate their pain. With medical advancements, we know that preborn children as young as 21 weeks gestation have been able to survive outside the womb. However, a paraviable infant, which is an infant between 20 and 24 weeks gestation, is a critically ill patient due to developmental immaturity, and they need medical care, including comfort-oriented end-of-life care. These born-alive infant survivors should be treated with dignity and given comfort care, which they would receive under HB 5047. Opponents of this bill may argue that there are no infants born alive following an abortion procedure, and this is simply not true. One CDC report found that over a 12-year period, at least 143 babies survived abortion procedures. Further, state reports show that 35 infants were born alive in Arizona, in Florida, in Minnesota, and in Texas in 2020 and 2021. This bill ensures that infants born alive following an abortion procedure receive medically appropriate and reasonable care and treatment, medical care and treatment. And as a result of these protections, the survival rate of infants that are born alive will increase, and more infants will receive essential perinatal palliative care. And just lastly, the bill would also provide for greater protections than what's offered for newborns in Rhode Island, as well as the Federal Born Alive Infant Protection Act. Therefore providing necessary and common sense protections for born alive infants. And I've laid that out in my written testimony. So I urge your support of that bill, and I'll mention briefly my testimony in opposition to HB 5006, which would require every Rhode Islander to participate in abortion by using state taxpayer dollars to pay for elective abortions. This bill would directly contradict with a policy under the Hyde Amendment and Rhode Island's state equivalent by forcing taxpayers to fund abortions regardless of their personal beliefs. This is concerning because the majority of Americans oppose taxpayer funding for abortions. In a 2022 poll, 54% of Americans said that they oppose the use of taxpayer dollars to fund abortions. And in a poll conducted only 1 year later, in 2023, 60% of Americans said that they oppose taxpayer funding of abortions. This includes Democrats and Republicans, and pro-choice and pro-life people. Rhode Island has listened to its citizens and passed a law that affirmed this pro-life policy at the state level by prohibiting taxpayer funding of abortion. However, this bill would reverse this long-standing policy and include elective abortions in the state's Medicaid program and under the state employee insurance plan. I urge this committee to oppose this bill in order to maintain protections that separate government funding from elective abortions, which is crucial to protecting the conscience rights of Rhode Islanders, and to ensure that the state continues to provide life-affirming assistance that empowers and supports families. I thank you so much for the opportunity to provide testimony today. Thank you.
Thank you, Danielle. Terry?
Yes, thank you. My name is Teresa Cody. I'm from Tiverton, and I strongly am opposed to taxpayer funding of abortion being used to fund abortions. I do have two points that I'd like to make. In the Rhode Island Constitution, it explicitly states that abortion is not a right. So I think that is something that needs to be looked at with regard to this bill. My second point is that I would like to propose a hypothetical situation to you. Suppose a Rhode Island legislature submitted a bill calling for the reinstatement of capital punishment in this state. I can only imagine the chorus of justifiable indignation and vitriol from a huge majority of the politicians and citizens of the state. Imagine the heated discourse involved, including, and again completely justified, the taking of human life as well as the idea of taxpayer funds being used to fund it. That being said, I find it rationally impossible to justify the use of taxpayer funds to finance what is plain and simple the taking of innocent human life and is nothing more than legal sanctioned infanticide financed by my tax dollars. Accordingly, I ask you to reject House Bill number 5006 and please put aside political expediency and do the right thing. Thank you.
Thank you, Terry. Next, we have Mary Kate Byrne, Sarah Murray, Giona Pacheco. Welcome. Just identify yourselves, please.
Gianna.
Sarah.
Okay. All right, Sarah, you want to go first?
Hi, thank you. Good afternoon. My name is Sarah Murray. I am here today as a member of the Women's Fund of Rhode Island's Policy and Advocacy Committee, and I urge you to pass the Equality in Abortion Coverage Act. When legislatures signed the Reproductive Privacy Act into law in 2019, it was a monumental step forward for the protection of abortion rights in this state. However, those protections do not extend to all the residents of Rhode Island. Rhode Islanders that receive health care coverage through Medicaid or work as state employees are banned from accessing abortion care. This ban impacts nearly 80,000 enrolled in Medicaid and 6,500 people on the state employee plan that are of reproductive age. What this tells me is that Rhode Island is interested in serving the women and children of the state in name only. Until this critical piece of healthcare legislation is passed, Rhode Island is telling the people, the women who work to keep the state up and running, the women who work to enact the legislature passed under this dome, that their health does not matter. Until this critical piece of healthcare legislation is passed, Rhode Island is telling its underrepresented and underserved populations that their health does not matter. Research makes it clear that when women do not have access to abortion care, they are more likely to suffer financially. Additional studies have found that laws restricting access to abortion widen the gender gap pay for women of childbearing age by pushing them out of the labor force and into lower paying jobs. When Roe v. Wade first passed, access to reproductive health care, including abortion, helped lead to increased labor force participation. It enabled many women to finish school, which increased their earning potential, and it allowed women to plan and balance their families and careers. Please let us continue this tradition of supporting and empowering the women of this state and pass the Equality in Abortion Coverage Act, H5006. I would also like to say that I am vehemently opposed to H5047, H5228, and H5573. Thank you very much.
Thank you very much. Giona?
Thank you, Chairwoman. I'm a resident of Rhode Island, and I'm here today in strong support of House Bill 5006, the Equality in Abortion Coverage Act. Rhode Island has already affirmed the right to abortion, but that right is still out of reach for many with limited financial means to access it. For the people who serve our state and Medicaid recipients, we should not be mandating which healthcare procedures they are not allowed to have. Instead, you can give them the option to make their own decisions about their body. No one should have to dig into their savings, rearrange their budget, go into debt, or rely on nonprofit organizations to afford a procedure not covered by their healthcare policy. You have the power to expand their access and provide relief to thousands of people who may need it. Since Roe v. Wade was overturned by the Supreme Court last year, approximately 24 states or so have responded in ways from criminalizing abortion procedures entirely to making them significantly more difficult to access. In nearly half the country, abortion care is inaccessible for those who may need it. Instead of hurting our people like other states are doing, and instead of doing nothing, let's be a state that protects and supports our people. Let's empower Rhode Islanders to make the choices that are right for them, especially in their healthcare needs. The EACA should be passed into law because here we support the right to abortion, the right to bodily autonomy, and the right for all people, regardless of income or employment, to make their own healthcare decisions. I urge you to vote to send this bill to the House floor and expand access to abortion coverage in our state because abortion is healthcare. Thank you.
Thank you. At this time, I'd like to call on Representative Baptista. Has a question for legal counsel.
Yep. Thank you. And thank you to the witnesses for testifying. I don't want to...
You guys are all set. John,
Yeah,
if you
you're
could
all
come
set.
up real quick.
Sure.
No, John.
You're in the hot seat.
All righty. Councilor, how are you? I don't have a question in that I expect you to answer it right now, but there have been some interesting comments made from a legal perspective that I'm really curious about, and I suspect this issue, you know, I don't want to add to the amount of homework you have to do, but if this issue is going to be researched, and if we're going to think about this, there's a thought that I have, and I certainly, you know, I mean this respectfully. I don't mean to pick a fight with anybody. I obviously am supportive of this legislation, but I respect the people who are testifying against it, and God bless them for coming forward and expressing their views, and I don't want to minimize anybody, but there's this interesting issue that's been brought up over and over again about this bill violating folks' religious rights because it would force people as taxpayers to fund abortions. And it makes me scratch my head a little bit. Like, there's actually an interesting legal argument, although I support the legislation. And so my question for legal counsel would be, is that analogous to, or in other words, let's do another example. Let's say instead of abortion, the state pays out settlements all the time. And oftentimes for state actors, government actors that do bad things, like a teacher that does something inappropriate or some other official. So let's say, you know, sadly, unfortunately, an example, an inmate at the ACI gets killed by a correctional officer, for example, and the state pays out a settlement for that person's family. Would that not be the same? In other words, can I opt out of that if I find it reprehensible that you know, this particular conduct, or sadly, you know, some of the things we've read about with teachers in schools? Like, I think there's something there. I'm not sure what it is, but I think that's a really interesting issue. And at some point, somebody's going to have to answer it, right? Whether it be us on the House floor or the Supreme Court justices, if it should get that far. But I kind of want to explore that issue, and I volunteer to work with you to explore it. But to the extent that we are, quote unquote, forcing people to fund things that are against their religion, I think there's some analogous situations to study and to look at, and I'd be curious to see how those issues compare, right? Because if we are honestly litigating something or putting together legislation that's going to be on shaky constitutional ground, we shouldn't do that, right? We should make sure that this legislation is strong so that we're not, you know, being inefficient and in the same place or worse off 5 years from now. And so I'd be curious if something like that, or if you do have a response to that now, sure, but I'm just kind of thinking about it, right? Like, the state pays out money for all sorts of things, settlements for all sorts of things, terrible things happen. So where do we draw that line, if that makes sense?
Right, understood. I don't have an answer for you right now. I would have to research that.
I'm going to take a stab at it. I'm going to bet you'll find a case out there that says the First Amendment says that Congress shall make no law respecting the establishment of religion, which we all shorten down to a thumb rule of religious freedom in America. But what the First Amendment says is that the government can't preference a particular religion over one or another. I'll bet you're going to find a fair number of cases, a lot of them in the sort of the taxpayer cases line, where the courts have said, unequivocally, emphatically, time and time and time and time and time again, we don't care what your personal objection is about what taxes may or may not be used for, because that is a question for the representative democracy in which you are a citizen. It's your job to pay them, unless you have a very specific injury unto yourself, and not just, I don't want to do this because I don't feel good about it.
in a nutshell, I think that's what the taxpayer cases, which is a line for those who are not lawyers, it's a line of cases in our jurisprudence. It's taught in law school. I think that that's where this answer is probably found.
Thank you.
No, you can't.
we're not
we
doing
don't
questions
do
like
that.
that.
You can't call from the back. No, sorry. No, you're not going to be able to do that. You speak when you're called on. Okay, are we all set?
Yes, thank you.
Thank you, John. You're welcome. The next group of witnesses, Dr. Ben Brown, Judy Zimmer. Oh, he left? Oh, he's already, oh, sorry. Judy Zimmer, Wendy Becker, Jan Chapin. Is Jan here? No? How about Bill Keene or Kenny? Bill Kenny? McKinney? Bill McKinney? No? David O'Connell? All right, ladies, you can begin. We're getting a list and nobody's answering.
Okay. I appreciate being able to speak to you today. Before I make my comments in favor of H5006, I would like it noted that I am opposed to H5047, 5228, and 5573. I'm speaking for myself. I don't represent any group or organization. I have no professional expertise as far as this matter goes, but I've been an abortion advocate since 1967. We hold this truth to be self-evident, that all women in Rhode Island are not considered equal, that they are not endowed by the state with the same inalienable rights as other women, and that the needs and desires of a certain segment of Rhode Island women have been abrogated, ignored, and dismissed. A substantial number of those women are poor and/or women of color. The main organization advocating for forced birth, ironically led in Rhode Island by a man, and originally created by a group of celibate men, ignores the fact that the arguments it presents, mostly of a certain religion's viewpoint, are not supported by a consistently significant majority of Rhode Islanders. Its self-named right-to-life point of view is not pro-life when it comes to ensuring that the neediest women in the state do not needlessly suffer because of an unwanted pregnancy. It's not pro-life when it comes to the lives of women who work for the state and in ways large and small make the lives of Rhode Islanders run smoothly. And let's not forget that pro-life also includes the quality of life as a major factor. Adding to the suffering of women is not pro-life. Dividing women into haves and have-nots, either by economic status or employer, isn't pro-life. The arguments of those who say they don't want their tax dollars to pay for abortions is specious at best, and 72% of Rhode Islanders disagree. Which of us don't want their tax dollars going to pay for something with which we disagree? Are we going to institute pick-and-choose taxation? Let's be frank. Passing the Reproductive Privacy Act in 2019 is only part of Rhode Island's codification of Roe v. Wade. To leave a meaningful segment of Rhode Island women without agency over their bodies, their families, and their very lives is reducing them to the status of lesser beings. I must ask each member of this committee, what politicians will you choose to make your medical decisions? I believe most of you know what must be done, and that is to give women in Rhode Island the power and respect to determine what is best for themselves. Let's stop tiptoeing around the real issue. Opposing the EACA is about power and control. It's not about respect or trust, let alone health care. It's time, in fact, it's long overdue, that every woman in Rhode Island must have the unequivocal right to decide if and when she can terminate a pregnancy. It's as simple as that. Thank you.
Thank you, Judy. Wendy?
Members of House Judiciary, thanks very much. I'm testifying on behalf of LGBT Action RI, an advocacy organization, part of a coalition, in support of H5006 and against all of the anti-abortion bills. Thank you to Whip Kazarian for sponsoring the legislation and to Rep. Agello for her decades-long commitment to this issue. I teach at Rhode Island College, and as a state employee, abortion care for my 23-year-old is not covered by my health insurance. It should be. This is legislation about fairness and access, irrespective of income or insurance. Rhode Island has already decided the government should not have the power to coerce someone into pregnancy or childbirth. However, our current policy of state employee health insurance and Medicaid denying coverage for abortion does exactly that for tens of thousands. We cannot continue to be a state where income is allowed to determine bodily autonomy, where health disparities are perpetuated, where pro-choice does not always afford a choice. I urge you to act positively on this bill, which is essentially a health care bill, a racial justice bill, a gender justice bill, and an economic justice bill. Access to abortion must be guaranteed to all Rhode Islanders, as the decision about when and whether to be pregnant impacts every aspect of our lives. Some argue they don't want taxpayer dollars being utilized to fund abortions. Obviously, taxpayers do not get to pick and choose how their money is used. That can't be how we run government. I'm also testifying in opposition to the anti-abortion bills which perpetuate false information could undermine our right to reproductive freedom. They're also incredibly ridiculous and insulting to doctors who just don't do what those bills say they do. We cannot create public policy with alternative facts based on mythology and misogyny. Instead, we must guarantee equity and access to all forms of reproductive health care for all people in Rhode Island. Let's pass the EACA. Thank you.
Thank you, Wendy. Next, I'm going to call these names again. Jan Chapin, Bill McKinney, I think. Is he here? David O'Connell. Okay, no answers. John McDade. Harrison Tuttle. And Annabelle Gibson. Okay, here's your three. Those three didn't get twice on the phone.
Go ahead, brother.
Hi, Mr. McDade. How are you?
Good, thanks.
Please just do me a favor. Talk into the microphone and give us your testimony, and we'll take it from there.
Thank you, Vice Chair Knight, members of the committee. I'm John McDade, a resident of Portsmouth. I belong to both the Humanists of Rhode Island and the Rhode Island Atheists, both of which are members of the Rhode Island Coalition for Reproductive Freedom, and I urge your support for H5006. I will not recapitulate the many good arguments that we've already heard, but I will pick up a thread that Reverend Jean articulated when he said it would limit the ability, the current situation limits the ability of his congregants to choose. I'm here to argue that the EACA is a religious freedom issue. Abortion is a medical procedure which should not be treated differently by the state or by insurance companies than any other. As a humanist, I believe that every person should be able to make personal medical decisions without state interference. And as an atheist, I contend that preventing people from exercising bodily autonomy based not on science, but on covert moral ideas about a procedure or who is entitled to it, constitutes a violation of the Establishment Clause. Non-scientific standards have no place in guiding public policies which infringe on First Amendment rights. The state has no compelling, government interest that justifies withholding this care from some of Rhode Island's citizens, and I urge your support for H5006. Thank you very much.
Thank you, sir. Harrison?
Thank you so much, members of the House Judiciary Committee. It's a little too close to my face, pump my nose. I want to echo a lot of the same points in favor of the Equality in Abortions Coverage Act today. Ultimately, BLM RAPAC knows that communities of color are affected by this the most. The burden falls on people that cannot afford it. The burden falls on people who are at most risk to lack of education, lack of housing, lack of resources to be able to take care of individuals if they are in fact born. And so this bill provides access to abortion through health care, provides access to nearly 80,000 Rhode Island residents who are enrolled in our Medicaid program, and almost 7,000 people who are on our state's employees plan. And so I urge the committee to pass this piece of legislation. I want to thank Representative Kazarian for putting this piece of legislation in. I want to thank so many advocates who not only have worked on this piece of legislation, but campaigns in the past for reproductive freedom in general. And I look forward to helping out and talking to any member of this committee, as well as the General Assembly as a whole, to make sure that this is passed. Thank you.
Hi, good afternoon. Thank you for allowing me to speak in support of Bill H5006 today. I appreciate the opportunity to share the importance of this bill. My name is Annabelle Gibson. I'm a lifelong resident of Rhode Island, a recent graduate of the University of Rhode Island, and a fierce advocate for reproductive rights. I've always considered myself lucky, as I have never found myself in need of an abortion. And I think that many of us assume that we will never find ourselves in that position. But as a young woman, I have also found that even in situations where we think we have control, we often don't. There is a misunderstanding that consent is like a contract to which there can be no amendments and from which there is no backing out. I'm white, I come from a relatively wealthy household, and I'm young enough to obtain health insurance through my parents. And I have found myself in situations where I could have gotten pregnant due to the secret contract of consent. It would seem that these instances of lack of control are universal for many, but the health care coverage to address the consequences is not. So what happens to those who are not as lucky as I am in terms of wealth, insurance, and familial support? Any woman or person of any age, race, or background could find themselves in these positions, yet without the EACA, any of them who depend on Medicaid or even state employees would not have the coverage to deal with their situation. Anyone is susceptible to unintended pregnancies, so why should abortion only be accessible to some of us? I acknowledge and deeply appreciate Rhode Island's choice to codify the right to an abortion, but the legal right does not equal access, and access for all is what we are asking for. I encourage you to vote yes on Bill 5006, and I thank you for your attention today.
Thank you, all three of you. All right, next, can we have Maureen Rigo, if you're out there? Tammy, who just came in from the overflow room, the bell room, and is Alicia Gauvin. Did I get that right? Yep. All right, come on up, Alicia. Maureen, you're next up.
Thank you. I sent a letter to your committee, a Judiciary Committee, yesterday, and I'm here today because I didn't hear from anyone, but I realized that yesterday was Sunday, and you probably don't have time to respond. I felt like I had sent a heartfelt letter. I'm here as a taxpayer, a mother, a wife, a lifelong resident of Little Compton, of Rhode Island. I grew up in Pawtucket. My husband was a Rhode Island DOT worker for close to 34 years. We raised 7 children on his income, and it was not easy. I was a stay-at-home mom because my children ranged in ages, but I felt that I had done the best for them. And I cannot believe the state that we're in, that womanhood and motherhood has taken such a hit that we have to provide abortion to the state workers and their families. Look, I'm not here because you're talking about root canal, because we all know that root canal is not covered, you know, in dental procedures. There's a huge hit to the pocketbook when you need a procedure that does not get covered. I'm here because we're talking about a child's life. And people throw the word abortion around so cavalierly, if that's a word, and I apologize. You know, fund abortion. I'm here on behalf of the taxpayers that I know that are out working today to make a living. We do not want our taxes used in this way. Yes, maybe we don't have a right to say where it goes as far as, you know, the educational systems, the public transportation, the hospitals, wherever our tax dollars go. I'm asking you to consider that not only is it a waste of taxpayers' money, but you will have blood on your hands, okay? And, you know, I've sat from 2 o'clock today. I'm just asking for a little respect. I totally respect that women could be found in a situation where they're not sure what to do with that next child. I totally get that. And yet, it's a child. And I'm very sorry that the rest of your committee is not here. I ask you to prayerfully consider that the taxpayers of this state do not want their monies being used this way. I'm not quite finished. I'm sorry. There was one other point I wanted to make.
Take your time.
And it's not coming to me.
I will say this while you're thinking about
Yes.
it. I did see your email, and I read
Oh,
it.
thank you.
So
And I'm here not because it's, unfortunately, in a lot of ways, it is a political issue. It is a religious issue. I'm here because it's a humanitarian issue. Do the right thing, please. Do not promote abortion with our taxpaying monies. Thank you.
Okay. And for the record, for some of you who don't know, I can't speak to everyone on the committee, but I do know that there are other places in the building and, of course, on Capitol TV where this hearing could be watched. There are, in fact, members of the General Assembly watching this hearing right now who are not on this committee.
Wonderful.
So there, you know, I don't know where Rep. Casimiro is, but I'm sure if she's not watching it live, I'm sure she'll watch it in short order.
Very
Okay.
good.
Alicia.
Good afternoon, thank you. My name is Alicia Govin. I work as the executive director for SHIP, which is a nonprofit organization based in Providence, providing a range of services to help adults unlearn sexual shame, heal from trauma, and engage with sexuality as a fulfilling part of their life, health, and relationships. I am providing testimony in support of H5006 and in opposition of H5047 and H5228. There are 27 states plus DC that mandate sex education, and 17 states require program content to be medically accurate. Rhode Island is one of those states that mandates sex education. However, we do not mandate that it be medically accurate. Evidence shows that comprehensive sex education prevents unwanted pregnancies, reducing the need for abortion. Without a nationwide, comprehensive, and medically accurate sex education policy, the extent to which people know how to avoid unwanted pregnancy can vary drastically. SHIP was founded in part to bridge that knowledge gap caused by the absence of a nationwide comprehensive sexuality education curriculum in public schools, and bridge that absence with the sexual health literacy expected of adults. We believe the choices about a person's bodily autonomy and reproduction should center around that person's needs and experiences. All people should have access to comprehensive information, resources, and support around their reproductive health. We affirm the right for individuals to make personal decisions about pregnancy, contraception, and family structure, and do not support restrictive controls that seek to cut down on reproductive care providers and/or options. Abortion is essential health care and should be affordable to everyone. That is what it looks like to truly protect the right to abortion, and everyone else has more or less said what else I have written. So in the interest of your time, I will stop talking.
Thank you, Alicia. Appreciate it. And Tammy, actually, I just got a note that you were coming in from the Orphan, so I don't know your last name. If you could just tell us who you are.
Yep, my name's Tammy Brown. I did fill out a form but it must have got lost somewhere.
It's paper.
Yeah, that's okay. So good afternoon, members of the committee. My name is Tammy Brown. I'm a lifelong Rhode Islander, a decades-long voter, and a concerned citizen. I'm here to testify in strong support of House Bill 5006, the Equality in Abortion Coverage Act. And while I appreciate members of the committee taking time today to hear this bill, I do question the timing. To hear this bill in the mid-afternoon on a Monday prevents the very people who are most affected by this bill, people working low-wage jobs and people who work low-wage jobs and receive Medicaid, and state employees. It prevents them from having their voices heard and advocating on this issue. So consider that in scheduling committee hearings in the future, please. I ask respectfully. That said, in 2019, we as advocates and the Rhode Island populace at large fought hard to codify the right to abortion into Rhode Island state law. This policy was vitally important as a matter of reproductive justice and human dignity, and was widely supported by elected officials in the Rhode Island House and a wide majority of the Rhode Island public. The passage of that bill was an acknowledgement that the right to determine your own destiny when it comes to when and if you want to become a parent is a central aspect of what it means to be entitled to life, liberty, and the pursuit of happiness, and to be a full participant in our society. While we were proud of the work we did then to secure access to safe abortion in the state of Rhode Island, we know that right still isn't real for hundreds of thousands of Rhode Islanders who are covered by Medicaid or the state employee health insurance. Safe, affordable access to abortion should have no bearing on your financial means or where you work. Low-income people and people who keep our state running should not be denied access to basic and vital reproductive care. We should not create a two-tiered system where some folks have access to care and others don't. In a free and just society, we must not let politics stand in the way of health and human dignity. This is a good bill that upholds the values of justice and equality and non-discriminatory access to health care. It's not the role of the legislature or government to make health care decisions for individuals. That said, with all due respect, the time for political games is over. It's time to stop playing politics with our bodies. We fought hard to make strides toward reproductive justice in 2019, and we will not stop fighting until that right is real for all Rhode Islanders. We know this bill has strong support in both chambers, and Rhode Islanders don't have time to wait. For every month that goes by without the passage of the EACA, more Rhode Islanders will be put in the perilous position of choosing between having enough food or paying their rent on time and vital reproductive care. So we will keep showing up. I know we've had these hearings a few years in a row now. We will keep fighting to pass this bill to make sure that the access for abortion coverage is real for all Rhode Islanders. Thank you.
Thank you. Very compelling. Okay, you guys are all set. Next, may we have Hannah Fernandez, Teresa Cody, and Shannon Sullivan. Shannon, are you out there? All right. Ma'am, what's your name? Hannah. You're Hannah? Okay. Teresa Cody? No. Shannon Sullivan? No. Roberta, is there anyone outside the room? Is this group? Okay. Susan Kinane? Did I say that right? You did. All right. Thank you. And try to fill out that last seat. Carol Larrabee, please come on up. Susan?
I'm Susan.
All right, Susan, why don't you go ahead, do me a favor, tell us your full name, and then just keep the microphone relatively close to your mouth so that the TV audience can hear it as well.
Is this okay?
Maybe a little closer.
A little closer?
There you go. Just talk right into it.
How's that?
That's great.
Better?
Thank you.
I'm Susan Kinane. Thank you for taking us. I know it's been a long day for everybody. I guess sorry, I might be a little nervous. I've never spoken
It's
to
okay.
anybody like this before.
That's all right. Listen, it's weird to come and talk to us. Like, I'm down with it. But you know, the beauty of it is that you can, and we're here to listen. So tell us what you think.
Thank you. I appreciate that. With everything that I heard today, I feel like common sense. I oppose taxpayer-funded abortion. It is in the Rhode Island Constitution that it's not afforded in our Constitution. It's against our Constitution. My husband and I work really hard. I don't want our dollars going. I believe that is a baby. I believe in life at the moment of conception. So for me, I don't want my dollars going to kill a baby, a beautiful baby. I know what it's like to scrape together my monies. I know what it's like to budget. I know what it's like to raise children. I know what it's like to be told when I go pay my taxes that, hey, do you know that you're eligible for something? I'm so stupid, I thought they were going to give me a card to go out for dinner, and it was food stamps. I don't want to pay to kill a baby. I understand that people struggle. So my question is, that really falls to the state. If people are working there really hard and they can't afford and they're in poverty, where does that fall to? What is the responsibility of the employer, of the state, of taxes that makes it difficult for families to raise children? Like, where does that burden fall? And to say that, like everything I heard was economics and hardships on families and all this stuff. There's so many wonderful organizations in the state of Rhode Island that have offered counseling. There are people out there and organizations that support women through their pregnancy and beyond. Like, there are things there from private organizations that are afforded to people, and there are people who are paying into it. I would much rather take my monies and put it into an organization that's going to help a woman. My home is open. You know somebody who needs a home, who needs to go see a doctor? I'm your guy, or your girl, whatever. Like, I'm here. My home is open. I don't have a bazillion dollars, but guess what? I will give you what I have. If you're a woman who's in need, I'm here. You know, I have grandchildren. My family is still growing. I raised 10 children. I lived underground for 15 years. Don't talk to me about scrimping and saving. I did it. And we are still building. My father taught me that if I don't have money in my pocket for something I want, then that something is not mine to have. So we made sure that we paid in cash for everything we had. And if I could budget really tight and come up with a couple of bucks, that went into a little savings account, and we bought a window. And we went without. And guess what? My kids are great. They're joyful, they're happy, they're madly in love with one another, and they love life. And if we can help, that's what it takes. It takes a community to help somebody out. Abortion is not the answer. Because guess what? There are also organizations out there that are gluing women back together who are suffering and hurting because all of a sudden their mind opens up and their heart opens up to the reality that they have killed their baby. I beg you, go home and pray. Really, really pray. Like really open yourself and give yourself to God and say, Lord, is this really what you wanted me? I was made for greatness. Is this what I am going to vote on? To kill another baby? And that someone else is going to work really hard and give the state their tax dollars for that? Is that really something that you want to put your head on the pillow and be proud of? I don't think so. You were made for greatness. That's not greatness. Planned Parenthood is a 501c3. So guess what? If 2/3 of the population of Rhode Island wants to give a tax donation, knock your socks off. But if the other 1/3 wants to put their money someplace else to help a woman out and help a woman up, and help her mentally, emotionally, physically, spiritually, and financially. Not just say, oh, don't have an abortion, and hey, good luck to you and the Boston Braves. No. They're there for these women to the end, if the woman wants it. There are organizations out there. I'm just saying, please, do the right thing. You're good people. Do the right thing.
Thank you for your testimony. Yes.
Hello. Thank you for this chance to speak. My name is Carol Larrabee. I live in Woonsocket, and I'm here to oppose H5006. I do not feel abortion is a very caring service to be funded with our taxes. Abortion is evil, which hurts women and men and takes the life of the baby. Men and women suffer mentally, physically, and spiritually for the rest of their lives, and the baby will never be born to enjoy life. For the 60 million babies that are no longer part of our society because of abortion, please forgive us. 45 years ago, I myself have had 3 abortions. Because of my selfishness, the regret I have, the shame, and the unworthiness of my choices have been tremendous and unbearable. I often think of how I gave the doctor permission to take my babies' lives away. Getting out of bed in the morning was not easy. I have come to thank God for his forgiveness. Knowing my children are in heaven comforts me. They know how sorry I am. And if I was to go back 45 years, I would choose to have them. Faith, hope, and charity, I love you very much. I also belong to a group called Silent No More. We are women and men who suffer from having an abortion. We tell our stories to many groups of people at schools, churches, and rallies, and hearings like this. This has been a very healing experience to myself and them, but also enlightens people of the horrors of abortion. My husband and I and our 8 children who are of the working class now, are tax-paying citizens and do not support the H5006. Abortion is never caring or compassionate. Thank you for your time.
Thank you. You're next.
Good evening. First, I just want to say thank you to the Judiciary Committee for taking the time to hear all of this testimony today. My name is Hannah Fernandez, and I'm a senior at Brown University. I study public health, and more specifically, the intersection of social justice and public health. I've been volunteering with Planned Parenthood of Southern New England through the student group Planned Parenthood Advocates at Brown since my sophomore year. I'm testifying in support of House Bill 5006. This bill will expand abortion access in Rhode Island, a state that people are often shocked to hear still has any restrictions on abortion, let alone restrictions that specifically target marginalized populations. As members of Gen Z, we are often told that we are the future of our nation. We were raised being told that there were a myriad of problems only we could fix, and we have become all too familiar with the feeling of the weight of the world on our shoulders. But reproductive rights were the one thing that we didn't have to worry about. Those had been secured not long before we were born, our mothers and grandmothers often the ones who tried so hard to protect us from that burden. They might not have known it at the time, but they were also giving us a source of hope that ultimately the power was in our hands. But here we are, in a state that fought the codification of Roe tooth and nail until 2019, again fighting tooth and nail for the protection that we so desperately need. We need these protections because we need to have hope that change can happen and that we are capable of creating it. I'm speaking very generally, but passing this bill would, in reality, not create the change that's necessary for the vast majority of Americans. Sorry. But it's not easy to carry the weight of the world on your shoulders, especially when it seems to just keep getting heavier as you go. And passing this bill would take even a little bit of that weight off, even for those that it won't directly impact. By passing the EACA, Rhode Island will join 16 other states that cover abortion in their Medicaid programs. This change is within our reach. It offers the opportunity to start giving some of that hope back to our future generations rather than taking it away. You, as the House Judiciary Committee, have an opportunity to protect the next generation from the irreparable harm that comes from the denial of personal freedom and individual power. I strongly urge you to take it by voting yes on House Bill 5006 and no on House Bills 5047 and 5228. Thank you for your time.
Thank you very much. Thank you, ladies. Okay, the next three are Alejandra Mazzargo, Brittany Curran, and Lydia Bartlett.
Chairman, as those folks are coming up, I did want to make a motion to be recognized, the fact that I'm here today.
He's recognized and he wants his votes recorded, correct?
In the affirmative as to all that were placed before you. I also wanted to be noted, I was about 15 minutes late, but I didn't want to interrupt and screw up the flow of what was going on. Thank you.
And we got a fourth person here. What's her name?
This is my baby Lourdes.
Okay.
She's 8 months old. I'm just going to read off of what I have written on my phone.
Sure.
I wasn't planning on speaking today, so it's not like very eloquently written. My name is Alejandra Mayorga. I'm a resident of Rhode Island, and I grew up on the south side of Providence, and now I live in Central Falls. I'm 25 years old, and I'm also Latina. I currently work at Rhode Island Right to Life, where I've been working for a year now, and every week we get hundreds of phone calls from mothers who are looking for material assistance for their children and babies. Many of them are pregnant or have newborns. I have seen how just a simple package with 10 articles of clothing, a pack of diapers, a few bibs, and receiving blankets have the power to light up their faces. Most of the clients are not financially stable. These women do not need so-called health care funds to eliminate the existence of their baby. The majority of them want to have their baby, and the majority of women who have come to us doubting whether or not they should have their child, it is not because of rape or incest, but because of the lack of money in their homes. Instead of funding abortions, we should be funding assistance for poor women who cannot provide for their babies because they want to keep their babies. Can I see that page? I strongly encourage you guys to vote against the House Bill 506, 5006, I'm sorry. And in regards to the House Bill 5047 and 5228, I think it's just common sense to protect and acknowledge a baby who is fighting for their life, to do something about it. If somebody were dying in front of me, I wouldn't just let them die. I would do everything in my will to save that person. And I think that the same thing should be done for unborn children. And the people who just let them die before them, the most innocent, the most fragile human beings that need our help. And if somebody who can do something for them acknowledges it and just chooses to let them die, that should be a crime. Just as it should be a crime if somebody is being killed before us and we do nothing for it.
Thank you. Brittany?
My name is Brittany Curran. I am also a Rhode Island resident my entire life. I have been involved in different communities of interracial communities, people. Sometimes I'm the minority. And I'm really thankful to be able to speak today. I vote against Bill 5006. I am a 28-year-old woman. I live by myself, and the money that I have to pay for healthcare out of my paycheck each week is already an enormous amount that I often live paycheck to paycheck just to pay my other bills. I don't think that adding abortion to that would help at all. I think it would say that it would keep the cost the same, but eventually the costs will be raised. And we encourage young adults to go out into the world and live by themselves or grow and be the person that they're created to be. But how can they do that if they can't even afford health care? If they, like the person said before, they can't even afford a root canal. I've heard so many things before that people should go to different countries to get decent surgeries because their health care doesn't provide it here. And it's unacceptable. I also work at Right to Life. And it is a very touching moment with the moms who receive sometimes 20 diapers for a whole month. They'll look at me and say, "This changes me." I don't know if abortion was available for them, but when most people see a baby, they light up. They make that change in their voice just to make the baby happy. Alejandra gets to bring her baby Lourdes to work, and it just brightens our workplace. Babies are people in the womb and outside of the womb. And our mothers chose us. They chose you, so you can make a difference in Rhode Island and in the world. I thank you for answering the call to be here and try to make a difference in Rhode Island, because a lot of people don't want to step up to the plate. So thank you for this opportunity to talk here. And again, I vote against Bill 5006, and I hope you will too.
Thank you, Brittany. Lydia?
Hello. Good evening. My name is Lydia Bartlett. I have been a lifelong resident of Rhode Island. I'm a teacher. I teach here in Providence, and I also work at Right to Life as well. I am here to tell a brief story in regards to being against Bill number 5228. Recently, a couple weeks ago, a mom came in to Right to Life, and she said, no estoy recogiendo para 3 niños este mes, estoy recogiendo solo para 2 porque mi bebé se murió. So she was only picking up for 2 of her children because her third child had passed away, her youngest, her child that was born in the end of August. So I talked a little bit about her and to her about her child, and she said directly after leaving, she was heading to the cemetery to bury her daughter, and my eyes were filling up with tears because that is a tragedy, and that is sad, and that is heartbreaking. Just as it is as sad and as heartbreaking that there are no consequences, or it is not enforced, or it is not punished when a child comes out of the womb who wasn't supposed to be alive but is alive, and if there are professionals that are not doing their job properly, that there are not consequences for that. That is just as a tragedy and just as a problem as a young baby dying at a young age. Why? Because there's so much future ahead of that child. There's so much in store. There's so much hope. You know, there's so much growth to be had. So that is my position on House Bill number 5228. In regards to House Bill number 5006, I am against that bill. I really hope that you hear the constituents today that we are not all for this bill. All right. Our taxes do not all want to go to paying for abortion coverage, insurance plans. And for those that are in the crowd or before me now, and if you would say to yourself, or I guess I just would like you to think about, if there was a bill for covering, if our taxes went to help moms so that they wouldn't have an abortion, if in your mind you're saying that's ridiculous, there's nonprofits out there that already do that. All right, then maybe you see where I'm standing on this. Thank you.
Thank you, Lydia. Thank you, ladies. Next group, Arthur Flanders, Stephanie Soto, and Catherine Anderson. The outside. Is Catherine Petromello here? Huh. Okay, why don't we try this? Who hasn't testified?
There we go.
So, right there, you come up first. And that one with the glasses and the black shirt in the back. Perfect. Okay. Sir, you go first.
All right.
You're Arthur?
I am Arthur. How are you?
I'm good, Arthur.
Good. Hello, thank you for having us. I'm here to testify in absolute support of the EACA, H5006, and the strongest opposition to the bills H5047 and H5228. Many of the members of this committee have repeatedly declared themselves to be pro-life. If that's the case, then do you support birth control? Do you support Medicare for all? Do you support aggressive increases in affordable housing or SNAP or increases in WIC? Do you support paid parental leave and universal free childcare? And what about gun control as well? I could call several of you out on how you voted against each and every one of these life-saving policies because you don't care about life. You hide behind the term and use it to mask your cowardice, your ignorance, and your hypocrisy. Those who, instead of promoting the health and safety of our community, would instead restrict abortion, would remove vital freedoms, and would make medical decisions for us, care nothing for the people. It is all about control. We see you. We know it won't stop at abortion, and it never stops at abortion. These bills present every one of you on this committee with the opportunity to prove me wrong, to protect your constituents and the very freedoms of their bodies. Those of us in this room today will hold you accountable for these words and for the empty promises that you make. Thank you.
Thank you. Yes, ma'am.
Hi,
What's your name?
My name is Clara Hardy. Thank you for having me. So I am in support of this bill. I'm a resident of North Providence, and I support House Bill 5006, and I oppose the other two bills that are anti-choice bills. I'm a licensed social worker, and I'm a Medicaid provider. I know from working with people who are low income on Medicaid that they don't have the same quality health care as those on private insurance. There are not many providers that accept Medicaid, as reimbursement rates are very low. I know because I get paid by Medicaid. So those who have the worst health care and have the most difficulty finding health care, that have the worst health care, get the worst health care, have the most health problems. This is just another way to discriminate against the poor. Banning abortion to those on Medicaid is another way to prevent low-income people from having quality health care. I remember as a young social worker, as opposed to being old now, working with a young Latina mother who had 4 children who she couldn't afford to care for already, and she was pregnant. She was on Medicaid and wanted an abortion. It was her choice, and she asked my help to find resources to access abortion care. I was able to help her find funding and supported her through the process. Deciding to have an abortion is not an easy choice to make, but it is a choice that women make sometimes out of desperation, because in our state and in our nation, we don't have a safety net to help prevent abortion, such as affordable and accessible daycare, affordable health care, and housing, and better wages. So for those who are against Bill 5006, then they need to protest like hell for public policies that will help women on Medicaid to help care for the already born, so that women who are poor and on Medicaid can get adequate health care, get good housing, get good food, and the necessities to safely care for their children. The people who protest against using taxes for paying for abortions, then they should also be against paying for murderers housed in the ACI. But there is no uproar about giving housing and meals to murderers. I work every day with those who are marginalized, those who are poor and desperate and are suffering and are struggling. If you really care about babies and children, then look at the dysfunctional government systems that make it difficult to get help for families in need and often keep people in poverty generation after generation. Thank you.
Thank you, Claire. Yes, ma'am.
Push this.
Oh, no, you don't need to push that. Oh, you just talk.
Is it working?
Yes.
Okay. So, hello, my name is Leslie Bonnell. I am a resident of Providence. I am a single mother, and I am one of these people mentioned that everyone keeps talking about, but no one has spoken about. I was a poor single mother who, unfortunately, birth control failed me, and I got pregnant. I already had a 2-year-old daughter, and I was absolutely incapable of being able to handle another child. And I personally, then therefore, put myself in financial risk in order to terminate the pregnancy so I could be therefore fully present in raising my daughter, who is now 20 years old. And what I would like to speak on is not about the morality of this or the spiritual attachment to this. This is a medical choice that is my own. It is not anyone else's, and even if someone is offended by the idea of taxpayer dollars going towards abortion or anything, we don't get to choose those things. This is how we live in a democracy. So if you don't want to pay taxes for those things, that's fine. Then you also suffer the consequences. Meanwhile, as a woman who lived on absolute public assistance, SNAP, WIC, Medicaid, which I actually am still enrolled in, I deserve the same rights and respect that those who do not necessarily fall into my category and in my demographic. I think one of the worst things that has come about from sitting and listening to this testimony today is hearing about people talk about people as if they don't mean like they're real. I am a real person. I made that decision for myself and not for anyone else. And the idea that we somehow limit those things or only some people are worthy of that type of choice, I find that offensive. I find that pro-life is a terrible way to describe a position that, in fact, I am pro-life. I am very much pro-life, and I would really like it if people could live their lives. But I am not going to suffer because some people don't agree with my personal medical choices. And if that is what we are actually arguing about, then I'm happy to continue to state that we have a separation between church and state, and other people's spiritual beliefs do not necessarily reflect my own, and I should not be able to have to suffer because they want something different. I am an absolute advocate of women's reproductive health. I am an advocate because I am both a board member of Planned Parenthood and now a board member of Rhode Island Now. All of these organizations and the work that they do isn't based on people's personal beliefs. It's based on legislation, law, and what infrastructure we provide for others. The infrastructure that would not be provided by not having House Bill 5006 is, once again, another opportunity to continue to keep women, especially people of color, Black women, Black mothers who are not necessarily making a ton of money and do not have the opportunity to have private funded insurance. We deserve the same rights as anyone else. Thank you very much.
Thank you, Leslie. Thank you. 3 more people raised their hand. All right. Yes, gentleman in the back. And I thought I saw a plaid shirt coming up. Yep, that's fine. You guys all come forward. Yes, sir. Go first.
My name is Robert Griffith. I'd like to testify in support of House Bill 5006, the Equality in Abortion Coverage Act, and against House Bill 5047 and H5228. I'm a 65-year-old pediatrician who was raised in a very conservative religious family from New England. My mother lived her life following a very strict and literal interpretation of Scripture, both the Old Testament and the New Testament of the Christian Bible. I finished medical school in 1983 and moved to Rhode Island to do my pediatric training, and finished that training at Rhode Island Hospital. Been practicing here since 1987. I have 2 adult daughters, a 2-year-old granddaughter, and a 2-month-old grandson. When I consider the question of equitable access to abortion services, I think of so many patients who I counseled during my office day. I think of so many families with children that are not wanted, but who come into this world after an unplanned and unprotected sexual encounter. So many of the adolescent boys and girls who I counsel are uninformed about the biological mechanics of sexual intercourse. So many are naive about how women and girls become pregnant. So many are uncomfortable about learning about birth control methods. So many parents are hesitant, uncomfortable, and lack knowledge about the reproductive process and the safe, efficacious use of contraception. Sexual relationships are complicated. They're driven by emotion and intellect. Oftentimes, I think emotions overrule that intellect. Unfortunately, many of us, most of us, do not behave rationally. Even if we were fully informed and cognizant of the risk of a pregnancy after a sexual encounter, many times we'd proceed regardless. A woman who becomes pregnant after such an encounter is in a very difficult position. Her life is changed irreversibly. Carrying her pregnancy to term means that she will bear responsibility for raising, feeding, and nurturing that child for at least 18 years. She will often do this by herself. This responsibility impacts her educational opportunities, employment, and her life's trajectory. This will also impact the environment in which that child is raised. Choosing a pregnancy termination, even early on in pregnancy, is a tremendously difficult decision, and I'm sure never made easily nor without emotional anguish. According to a poll conducted by Impact Research in August of 2022, 7 out of 10 voters in Rhode Island believe abortion should be legal, including 57 of those who identify as Catholic. 66% of voters support passage of the Equality and Access to Abortion Care Act. Our Constitution was created in part to secure the blessings of liberty. Liberty can be defined as freedom from arbitrary and unreasonable restraint upon an individual. Restricting a woman's choice and access to health care regarding pregnancy seems to limit her liberty. If we view pregnancy termination as ending a human life and therefore sin, we must remember the words of Jesus. When a woman caught in adultery was confronted by her accusers, Jesus said, "Let he who is without sin cast the first stone." Thank you.
So I want to begin by, I don't think this is on, right? Yeah, okay. So I want to begin, so my name is Robin Lindy. I'm a professor at Rhode Island College. I also serve on the board of Amnesty International USA, but I speak here in my capacity as a local leader of Amnesty Providence. So I want to begin by thanking the members of the House Judiciary Committee for allowing me to provide testimony today. It's a great privilege to appear before you and to support the Equality and Abortion Coverage Act. So as you know, Amnesty International is a nonpartisan, non-governmental organization that has been working for human rights for more than 60 years. We affirm that access to abortion is an essential component of a fair and equal society and is integral to realizing the full spectrum of human rights. We advocate for access to reproductive health and services, provided in a manner that respects human rights, autonomy, and dignity, as the right of anyone who can become pregnant. Amnesty PVD, or Amnesty Providence, support of the Equality and Abortion Coverage Act is based on a policy that's developed in consultation with human rights experts, medical providers, and the Amnesty movement, informed by years of research concerning women and girls whose lives have been shattered by restrictive laws. We demand that governments respect the reproductive autonomy of women and girls, and we campaign for safe abortion access for anyone who seeks it, without discrimination, coercion, or stigma. Around the world, approximately 47,000 women die each year as a result of unsafe abortions. This will not end until abortion is made accessible and affordable to everyone. We recognize that decisions around pregnancy and abortion have a direct impact on the full spectrum of human rights. Abortion should be treated like any other health service, and anyone seeking an abortion should be met with compassion and dignity. Amnesty's position is endorsed by the International Federation of Obstetricians and Gynecologists, which represent national societies of medical professionals in 132 countries and territories. Abortion is a complex sociopolitical issue, and discrimination against this particular health service by denying its coverage under insurance perpetuates gender and economic inequality. So in support of the Equality and Abortion Coverage Act, we advocate for the removal of all barriers to safe abortion and to promote reproductive, gender, and economic justice. Thank you.
Hello.
Yes, sir.
Yes, Tom Malloy. I'm from Cranston, Rhode Island, and I have a short little thing. I think I'd say I'm against taxpayer funding I'm against 5006, and I'm against any taxpayer funding of abortion. And as I think of all the good arguments that I've heard, now and before for and against this bill, it occurs to me that there's one argument that preempts all other arguments. And I feel just because we have gone down a certain path doesn't mean that we should continue down that path, and it doesn't mean that we should fund that same path. So the argument that I think is preemptive of every single argument that we hear today is that at the moment of conception, the embryo is a human life, and with it, it has its own unique DNA, and therefore it is a person and deserves protection. And to remove that life would be killing a person. So therefore, I think that's the only argument that should be made, and it's I believe preemptive of all these other arguments. Thank you very much.
Okay. Thank you very much.
Thank you.
3 more folks that wish to come up and testify. No one in the front row. Let's see. Yep. Red plaid shirt. The woman with the green sweater on with her hand up, and the man next to her. Oh, okay. Nope. Go ahead, sir. Plaid shirt. Could you tell me your name?
Hi, is this, can you hear me okay?
I can.
Okay, my name is Alex Taylor. I'm a resident of Providence. I have not lived here my whole life. I don't know if that is relevant to the testimony, but.
You can't testify, I'm sorry.
So yeah, I'm here in support of Bill 5006 and opposed to the other 2 bills. I came to mostly talk about issues of equity and then also the but I don't want to pay for it argument. But I think those have been really adequately addressed by previous people. So I'll mostly just say I am another person who has taken time out of their day to come here and support 5006. I would like to second Tammy Brown's suggestion that I know it's a complicated issue to make space available for people to testify regardless of what their work situations are. But I would, I think that's an area where we could continue to improve. But thank you for your time. Please forward 5006. Thank you.
Thank you. Yes, ma'am.
Me? Hi, my name is Stephanie. I am a board member of the Women Project, and I'm here for Bill 5006. I am going to read someone's testimony, but before I do that, I do want to say something that was missed here a lot, and is that, yes, this is an issue that affects women of color. It's an issue that affects the poor, but it's also an issue that affects people with disabilities like myself. So right now, there is 98,000 people that are not, that are in Medicaid, that are adults. 25% of them are disabled people. A total of 13,475 people of those are women that can bear children, that have intellectual and physical disabilities, that are on Medicaid, and that currently won't be able to have an abortion if they are assaulted. Women with disabilities have an 80% chance of being assaulted and having unplanned pregnancies, and this is an important part of actually doing something not only for women of color, the poor, but also people with disabilities, which is also a topic that is never really talked about when we talk about reproductive justice. And with that, I'm going to move forward and read a testimony from a colleague of mine who couldn't be here because she has a test, and she is a medical student at Brown University.
What's her name?
Her name is Kaylin Takeda. So she says, "My name is Kaylin Takeda. I am a Rhode Island voter and a resident of 7 years. I'm also a rising 4th-year medical student in Albert Medical School at Brown University, where I was the leader of our school's chapter for medical students for choice, a national organization. Next year, I will begin to provide abortion care as a family medicine resident physician. I am here today in strong support of the EACA. I see inequity in healthcare every day in Rhode Island. Not all patients can afford life-saving therapies for cancer or diabetes. Inequities in accessing safe abortion services is no different. I see women who can't care for their child as they battle substance disorders. I see survivors of sexual violence for whom it would be a perpetuation of their worst nightmares to carry a fetus. Expanding abortion coverage to Medicaid recipients and state employees would save money for our healthcare system. Complications from self-managed abortions that women will follow through with regardless of the law. Life-threatening birthing complications and the cost of supporting a child for those who can't afford to do so. All cost Rhode Island more than it could cost to expand abortion services under Medicaid and for state employees. Without comprehensive reproductive health care, we let our neighbors slip through the cracks and suffer. And as a healthcare provider, I can only do so much. We are burnt out. And so much of that is in the hands of policymakers who have the power to improve our patients' lives. We need our help, your help, and please take the word of heart and pass the Equity in Abortion Coverage Act. Thank you.
Thank you. Yes, sir.
How about now?
Now
Okay.
I can. Yep.
Thank you. Members of the judiciary, thank you for your time this evening. I appreciate your attention. I come to you, my name is David Mitchell, lifelong resident of Cranston. I come to you as representing the Little Flower Home. We deal with poor and marginalized people every single day of the week. We provide housing for homeless pregnant moms and their children. What we really do is we connect the need to the resources that are out there. And abortion should never be, unfortunately, too many poor women think that abortion is their only option when there are so many resources out there to help them. We give these women, these moms, a place to stay. We help them, find long-term permanent housing. Unfortunately, many of the moms that come to us have been in a situation where they've been pressured into an abortion by their boyfriend. And the phrase is basically, you either have an abortion or you move out. And they come to live at the Little Flower Home. So there are plenty of options out there. I will just say to you that 200 years ago, our country was very divided. Some states believed that slavery was a good thing, and other states believed that slavery was completely evil. 200 years later, here we are today, very divided over this very issue. I will say that the momentum is on the side of life. We've seen that at the federal level, and things are changing. I will say 200 years ago, a whole class of people were discriminated against because of the color of their skin. I will say now that a whole generation of people are being discriminated against because of their age, their unborn, their size. They have unique DNA. They deserve a vote. They deserve an option. They deserve a right to life. So the government should never be in the business of exterminating people of color. The government should never be in the business of marginalizing and exterminating people that are homeless or poor or whatever. So I just ask that we do not have taxpayer-funded abortions in Rhode Island. The state is very much against it. It will absolutely impact the revenues that come into the state. Many people, such as myself, everyone at the Little Flower Home is a volunteer. We do not receive any state funding. I work for a very good company based in San Francisco. I could live anywhere in the country, and I will not allow my taxes to be sent towards abortion. There are many other people like me that work remotely and have options on where they live. So it's not a good thing for the state. The state has enough things to pay for, and this is absolutely, you don't want to be in the business of exterminating people of color. Thank you.
Thank you, David. 3 more volunteers from the back. We've got 2 folks over here. Christina, do you want to come forward? Christina, come on up. Oh, I'm sorry. Oh, somebody said, you're first, you're on deck. Okay, who wants to go first?
Dear Chairman Craven and honourable committee members, my name is Caroline Dooley and I live in Portsmouth in Rhode Island. Thank you for the opportunity to testify on House Bill 5006. This bill would make me pay for a crime, premeditated murder. As a practicing Catholic who hopes to spend eternal life with God, this would go against his plan for me as his child and for his children protected in their mother's womb. It is against God's plan for salvation and against the civil rights of every child conceived. Your job is to protect and serve, not your own interests, but the safety and basic civil rights of all the children of Rhode Island, from conception to natural death, the most important of which is their right to life. How can you equate saving 5.4 million with murdering children? Don't pave another 5 miles of our roads, and you can save that. Can't our treasurer, if he is worth his pay rate, avoid having to kill God's children? Abortion is not health care. It is murder of the innocent. Every vote in favor, every silent voice, we will stand before our God and give an account. Provide low-income housing with my tax money to enrich the lives of the poor. Education is the key to success, and Providence schools are abysmal. As a Catholic mother of 6, teacher of the young, and advocate for the unborn, I plead with you to do some serious soul searching. We are living in a state without hope. Equality is for everyone, from conception to natural death. Only God has the authority and the power to bring us in and out of this world. You have not been given that power. You are overstepping your boundaries. Thankfully, God is all-powerful, everlasting, and the Father of all. May he watch over all of us today and guide our hearts so that we can have and protect with love every human being so that they can live in a state who serves and protects them. Then we can all live healthy, long lives, sharing our treasures and our talents as God intended. And I am not anyone to speak, so I am going to give you the words from God. Keep far from a false charge, and do not kill the innocent and righteous, for I will not acquit the wicked. Thank you for giving me this opportunity.
Thank you. Yes, sir.
I'm on. Thank you.
Yep.
Thank you for the time. Thank you for the effort that everybody puts in to hear 8,000 people speaking to you tonight. You must be exhausted. I'm tired just listening to it. There has been so much spoken here tonight about these bills. I think I don't want to rebut a lot of the stuff that's been said, so I'm going to tell you 2 stories. I'm speaking on my behalf and on behalf of my wife. 2019, this legislature passed a bill which enabled abortion for all practical purposes through all 40 weeks of pregnancy. Now you're asking us to be complicit in paying for it through H5006. It is, I can't tell you how appalling it is. We had a premature baby. She was 2 pounds. At the same time that she was born in the same hospital, they were taking the lives of children the same size. The cognitive dissonance that it took at that time has never left us. I'll tell you one more story, and then I'll be quiet, about the effect this has had on the medical industry and on our society. My wife was an OB/GYN nurse for many years, delivered hundreds and hundreds of babies, I helped deliver. She was on duty one night, and a doctor came in. She had noticed, and this was in late 70s, right after Roe v. Wade really started to take effect in the medical community. A woman came in, and she was in early labor. My wife tried to stop the labor because the baby was too small, about 6 months. Doctor came in, and it was a doctor who frequently did abortions. He told her to put Pitocin and rush accelerate the labor. She refused. He threw a clipboard, one of those heavy metal medical clipboards, across the room and hit her with it. Went over and put the Pitocin in. And the labor proceeded. He put the woman completely under. She had no idea what was going on. Baby was born at about 1.5 pounds. He took the baby and he threw it into the stainless steel placenta pan and left it there. My wife had called the nursery nurse to come over, and she did. Her response is what any normal human being would do. She picked the baby up, she cleaned it, the baby was breathing, her heart was beating, perfectly formed little girl, but about 1 pound. No chance the girl was going to live at that point in a rural hospital in Maine. But they took care of her, and they held her, and they comforted her. They sang to her. The baby died. I think that is what when we inure ourselves, when we sear our consciences by allowing the medical profession to be complicit and asking us now as taxpayers to be complicit in this, we're hurting ourselves as a culture. It's not a marginalized religious issue. It's a baby. It's a baby. You've all held them. We don't want to pay for killing them. Thank you for your time.
Sir, what's your name?
Oh, Jack Parquette, I'm sorry.
Okay,
Didn't I say? Jack Parquette, I'm from Portsmouth, Rhode Island.
Thank you, Jack. Yes, ma'am.
Yes. My name is Terry Plant. First, I want to say that I believe in good health care for services for all people, but this bill, Equality and Abortion Coverage Act, is a bill to extend the scope of abortion using taxpayer monies in both Medicaid and state employees' health insurance to destroy a preborn baby, boy or girl, a precious human life. I believe that there's already state funding on abortions performed in cases of rape and incest and life of the mother. I oppose this House Bill 5006. And again, I want healthcare services for all and to continue financially supporting good health services to individuals and families that are really true life-giving, maternal health care services, health care centers in local neighborhoods, and family service agencies. Thank you very much for all of you for listening.
Thank you very much. 3 more witnesses. Christina, come on up. And let's see, Dr. Megan Smith and Dr. Catherine Anderson.
Good evening, everyone. My name is Dr. Catherine Anderson, and I'm an OBGYN resident at Women and Infants Hospital of Rhode Island. I'm here this evening in strong support of the Bill H5006, or the Equality and Abortion Coverage Act. And this is because I believe in equitable access to healthcare services for all Rhode Islanders. I'm confident that everyone in this room knows that financial barriers to healthcare cause real harm and can be life-threatening for patients. This is true of cancer screening, this is true of access to diabetes medication, and this is true of abortion. As an OBGYN, I know that the health risks of abortion are lower than those endured during pregnancy. But this is only true if safe, legal provision of abortion is guaranteed. I have seen patients come into our emergency department bleeding heavily after taking unknown abortion pills from a friend because they could not afford to receive a safe abortion under the close supervision of a trained medical professional. In the pre-Roe era, there used to be entire units of hospitals dedicated to the complications of quote-unquote back alley abortions. My family lives in Texas, and I am proud to live in a state like Rhode Island where abortion is safe and legal as of 2019 when the Reproductive Privacy Act was codified. But I am heartbroken that so many of my patients still do not have access to full reproductive services solely because of the type of insurance that they have. 25% of Rhode Islanders are on Medicaid, and under the current system, abortion is not a feasible option for many of these people due to financial constraints. There is no right to abortion in Rhode Island until equal access for all is ensured. The EACA is not a question of the morality of abortion, but rather it is a question of health equity and whether or not we are willing to address the disparities that exist in our communities. The current law disproportionately affects those with low income and persons of color, the very same people who the healthcare system is currently stacked against. A person's income should not dictate whether they have a right to be healthy. Safe and equitable access to abortion will improve birth equity in our state, and I know it will save lives. These patients deserve better, and every Rhode Islander does. I thank you all for taking the time to listen to us this evening. Now please help me do my job as an OBGYN and allow me to provide life-saving services to all of my patients, regardless of their insurance. Thank you very much.
Thank you, Doctor. Christina?
Hello, buenas noches. My name is Cristina Contreras Fox. I am the Director of Policy for the Rhode Island Black Business Association. We are a member of the Rhode Island Coalition for Reproductive Freedom, and thank you for the opportunity to speak before you today. The Rhode Island Black Business Association envisions creating a more sustainable and equitable business climate in our state, and that does not exist without reproductive freedom. I come before you today on behalf of REBA to affirm our unequivocal support of H5006. When Rhode Islanders have full access to affordable and safe abortion coverage, they control their own economic future. That access should be afforded to every single Rhode Islander, regardless of income status or employment status. A direct connection exists between access to abortion and economic security, especially for Black people who can get pregnant. Many of my colleagues have already given many compelling data points illustrating how abortion access impacts economic security for Black Rhode Islanders. And I want to emphasize, abortion legalization has led to significant increases in high school graduation, higher education attainment, and workforce participation amongst Black Americans. Yet in our state, this critical essential care remains out of reach for thousands. It is imperative that Rhode Island rights this injustice immediately and helps secure reproductive freedom and thus economic security for all Ocean Staters. The economic competitiveness of our state and the ability of all Rhode Islanders to live to their fullest capacity depend on it. So please pass this to the floor with your full support. And thank you again for the opportunity to come before the committee today.
Thank you. Dr. Smith? Good evening.
My name is Dr. Smith.
The other way.
Sorry. Good evening. My name is Dr. Smith. I'm also a resident physician at Women and Infants Hospital, Brown OBGYN. I am here today, like my colleague, to urge you in supporting the EACA. As a physician, I can tell you that certainly abortion is an essential part of healthcare, like any other service that we give, any other medical condition. And these decisions should be left to patients and in discussion with their health care providers without the influence of other parties. And that includes financial limitations as well. Beyond this, access to abortion care, like any other medical care, should not be limited by insurance status or financial burden. As an OBGYN, I see firsthand the detrimental effects that limiting access to abortion care and other care can provide or can be to patients and their families. Rhode Islanders have already demonstrated loud and clear their stance on abortion access in passing the Reproductive Privacy Act in 2019, which codified privacy rights and reproductive freedoms guaranteed by Roe v. Wade. But in order for this action to be considered a success, we need to ensure that all people in our state are able to access safe and legal abortions. This comes in the form of adding coverage of abortion to the state Medicaid program, a stance that's backed by our national governing body, ACOG, and that is our body of OBGYNs. They affirm that public and private insurance coverage of abortion care should be considered an essential part of healthcare services and not singled out for exclusion or additional administrative or financial burdens. The EACA will treat all Rhode Islanders fairly by adding coverage of abortion to our state Medicaid program, which covers over 315,000 Rhode Island residents, as well as eliminate harmful laws that prevent more than 17,000 state employees and their dependents from using their insurance to cover abortion. Inaction will only result in exacerbating dangerous inequities faced by communities who are already experiencing systematic barriers to health care. With regards to unintended pregnancy and abortion, disparities continue to persist, in part due to longstanding oppressive legislation and racial inequality that exists here in Rhode Island, like it or not. Low-income women and women of color are more likely to experience unintended pregnancy and abortion, and women of color are more likely to rely on Medicaid. Until we are able to pass the EACA, we are not providing equitable care in Rhode Island, and we are not doing right by our residents here. I urge you to please, again, allow us to do our job and treat our patients with the respect and equity that they deserve. Thank you so much.
Thank you very much, Dr. Smith. You guys are all done. And do we have any more volunteers? I think we're down to the back row now. I don't see any hands. Wait a minute, somebody walking in? Okay. All right. So I think that's the end of our testimony on these bills, and we get to a motion to adjourn.
Motion.
Second.
All those in favor signify by saying aye. Aye. Opposed, nay. Thank you very much. You were very efficient.